I ask all of our guests to please take their seat. The Subcommittee on Oversight and Investigations will now come to order. I now recognize myself for a 5-minute opening statement. Today's hearing is the first opportunity for Congress to hear testimony from Dr. Mandy Cohen since she was appointed the CDC, Centers for Disease Control and Prevention, Director in July. Dr. Cohen, congratulations on your appointment. You are taking the reins of the CDC at a critical time in the agency's history, and you have a heavy task ahead. As I said at our June oversight hearing, the COVID-19 pandemic revealed that we did not have the CDC we thought we had. I'm looking forward to hearing about how you plan to change that. This hearing is also an opportunity for us to hear firsthand about how the CDC is responding to the ongoing respiratory virus season. I'm particularly interested in hearing about how CDC is helping to mitigate the shortage of respiratory syncytial virus, or RSV, immunization for all infants. We have already heard reports that RSV cases are rising sharply in certain areas of the country and that some hospitals are in surge mode. With unprecedented demand for RSV immunizations this year leading to supply constraints, I hope we will hear what the CDC plans to do to ensure we have a sufficient supply of product for the seasons to come. It's great that we have a safe, effective RSV immunization to protect our children, but it does us little good if we don't do a better job at preventing supply constraints. Questions remain. How is the CDC planning to rebuild public trust in the agency? Has the CDC learned from the mistakes it made during the COVID-19 pandemic? Is the CDC committed to making the hard and deep reforms needed to avoid repeating those same mistakes? While I'm looking forward to hearing your testimony on these points, I candidly haven't seen much outward evidence yet that the CDC has taken the failings of the COVID-19 pandemic to heart. Another area I have grave concerns about is the detrimental effect extended school closures have had on our kids' learning. According to a report by the National Assessment of Education Progress, the average testing scores for U.S. 13-year-olds has hit the lowest level in decades. According to a New York Times report from earlier this month, school closures led to 50 million children, including my own, being out of the classroom, causing these students to miss an extremely crucial time in their lives since they were forced to attempt to learn from home. And let me assure you, learning from home for school-age children is not as effective as being in the classroom. In the same report, the Times claims this may prove to be the most damaging disruption in the history of American education. The damage wrought by school closures was enormous, and our children will be living with its consequences for decades. As I've said before, for better or worse, CDC recommendations and guidance carry great weight. They were used to justify not only school closures, but prohibiting nursing home visitations and vaccine mandates that would have resulted in millions of Americans losing their jobs. In addition, businesses, fitness centers, and worst of all, churches and other places of worship were closed. Further, the discovery of an illegal biolab in Reedley, California exposed more problems at CDC. CDC's management of the Federal Select Agent Program has been subject to criticism in the past for inadequate investigations in response to biosecurity incidents, including investigations from this very subcommittee. Reading the China Select Committee's report showed how inadequate CDC's approach to the Select Agent Program is. CDC initially refused to even investigate the lab and only did so once they were contacted by Democratic Representative Jim Costa of California. The CDC even refused to test any of the thousands of pathogen samples that may have contained and could have contained unknown and dangerous pathogens. The agency also failed to take meaningful action regarding a refrigerator that was labeled Ebola during their so-called investigation. CDC's response was totally inadequate and failed to provide any support for the local government and put the public at risk through indifference. This is not acceptable, and the CDC must do better. As we look to the future, it's clear that the CDC needs to do more than just a reset. There needs to be a seismic shift. The agency announced in April of 2022 that they were going to undergo a reform by starting to review their processes and structures in place. Since, they have made a handful of changes, but more is needed. I know that you've not been there long enough to implement a seismic shift, but I hope we can start to see CDC guidance driven by the latest science and robust evidence. In closing, I hope your tenure as director will start that process and reinvigorate this important agency. Thank you. And I yield back to myself and now recognize the subcommittee ranking member, Ms. Castor, for her 5-minute opening statement.
Well, thank you, Mr. Chairman, and good morning, everyone. Welcome, Dr. Cohen. Thank you for your service as the newest director of the Centers for Disease Control and Prevention. The timing of your appearance here today is very important, as we want to ensure that all Americans have all necessary information to protect themselves from respiratory disease as we head into the season of higher infections and illness driven by flu, COVID-19, and RSV. This subcommittee held a hearing in July on how CDC can improve its effectiveness in performing its core public health missions, but they did so without having anyone from the CDC who could provide a substantive update. So thankfully, we can hear directly from Dr. Cohen today about her priorities to help Americans stay healthy and to prevent and fight disease. One of the strengths of the CDC is that it works in collaboration with states and local communities. Strong public health partnerships and infrastructure are our best line of defense against disease. Families, communities, businesses, and policymakers like us rely on up-to-date information to understand risks and to devise prevention strategies. Working together, we can improve the lives and health of Americans. Earlier this week, CDC released data showing that life expectancy in America last year increased slightly after a decrease in 2020 and 2021 due to the heavy toll caused by COVID-19, where over 1 million Americans lost their lives. Even with that slight improvement, we are struggling compared to other wealthy countries. Nevertheless, thanks to the historic emergency legislation passed by Democrats in the last Congress and the extraordinary efforts of communities and health professionals across the country and the Biden administration, we've put the dark days of the pandemic behind us. We can focus anew on ongoing public health threats like heart disease, cancer, maternal mortality, opioid addiction, suicides, and gun violence. For a country that is grappling with debts and deficits, and for families looking to lower health care costs, it's more important than ever that we ensure that all Americans have access to good nutrition and life-saving vaccines, and that they don't start smoking cigarettes. Unfortunately, nearly 4 years after the onset of the COVID-19 pandemic, some of my Republican colleagues continue to aggressively undermine cost-saving prevention work and malign scientists performing life-saving medical research. The Republican majority has actively opposed strengthening public health and failed to use the lessons learned to better position America to respond to a future health emergency. Republican budgets in Congress tell the story. Instead of working to keep our neighbors safe and avoid higher health care costs, Republicans want to take us backwards through harmful cutbacks, shutdowns, and budget showdowns. Meanwhile, Democrats are working to put people over politics, to keep our neighbors healthy and well, to prevent unnecessary hospitalizations and deaths, and to be ready for the next Ebola or Zika or coronavirus. You never know what is going to happen. For example, earlier this summer, Sarasota, Florida, just south of me, they experienced a surprising outbreak of malaria with patients hospitalized. Thank goodness CDC experts jumped in to aid the community and develop a containment and prevention strategy. See, there hasn't been a malaria outbreak in the United States in 20 years. And that's good, because malaria is one of the world's greatest public health problems and affects approximately 219 million people each year, with over 600,000 deaths. So we're grateful for the strong response by CDC, but it's also a great example of the importance of timely information for the public. Access to timely health information became entirely too political during COVID, when some officials in my state and in other places concealed and altered information that the public needed. So I hope we can all work together to improve the availability of accurate and timely health information for the public. Even in the best of circumstances, CDC has a very difficult job. While some politicians are intent on discrediting CDC or actively spreading misinformation, as former President Trump did repeatedly in 2020 during the height of the coronavirus pandemic, and as the governor and Surgeon General in my state, Florida, continue to do so today, gosh, the job gets so much harder. So we can do better. We can come together to support the public, improve the public health, make sure that all Americans, our neighbors, stay healthy and well. So I look forward to hearing from Dr. Cohen today about CDC's efforts to strengthen prevention efforts and keep Americans healthy and safe. Thank you, and I yield back my time.
Thank the gentlelady. Now recognize the chair of the full committee, Ms. Rodgers, for her 5-minute opening statement.
Thank you, Chair. Here we go. Thank you, Chair Griffith. And I'd also like to welcome and congratulate Director Cohen as becoming the director of the Center for Disease Control and Prevention. I believe that we must have a transparent and honest conversation about the future of CDC, an agency that has never and needs to be authorized by Congress. Director Cohen, you might be the last appointed CDC director without a Senate confirmation, and your actions and decisions can help return the CDC back to its fundamental mission, or your actions could allow the CDC to drift further away and worsen public trust. We want to hear from you today about CDC's preparedness for the current wave of seasonal viruses such as flu, RSV, and COVID-19. And at the same time, we want to examine CDC's past decisions and guidance to understand how you're taking lessons learned from COVID-19, Mpox, and other recent public health threats to improve our current and future public health strategies. This is a chance to restore transparency and build public trust in our health institutions and ensure that CDC's issued guidance is clear, practical, and consistently relevant and up to date with the latest science. Sometimes this may include telling the American people what the CDC does and doesn't know. To put this bluntly, your predecessors took bad advice. They acted on bad advice due to political pressure and misled the American people. The institution you now run influenced schools to remain closed by listening to non-scientific stakeholders, namely the teachers' unions. And because of their guidance to keep schools closed for an extended period, our children, the very future of our country, now suffer generational learning loss and devastating mental health conditions. The gravity of the situation is clear. If we fail to restore trust in public health institutions and correct past mistakes, the consequences for our children and our country could be dire. It is in this context of urgency that we must consider the substantial investments made during the pandemic. Congress provided schools with $190 billion to combat COVID, allocating the estimated 20% to mitigate learning loss. And despite these efforts, students in grades 3 through 8 are lagging months, if not years, behind in reading and math abilities. Nationwide, our children's academic performance has suffered a historic decline, with reading and math scores plummeting to the lowest levels in 30 years. Further, school attendance is down, and students are dealing with a crisis of loneliness. These facts are not merely statistics. They are our children, our nieces and nephews, our neighbors' children. They're the next generation, and right now, this is a stark indication of the broader fallout from actions taken during the COVID-19 response that we're only beginning to uncover. As we reflect on the events that led us to this point, we must acknowledge the weight of responsibility that comes with being the director of the CDC. The agency's guidance has far-reaching implications affecting not just public health, but our day-to-day lives and the overall well-being of our children. It is imperative that we see a commitment to cooperating with Congress. Too many of our inquiries to your predecessor went inadequately answered or wholly ignored, and I think we all agree that being transparent with us and the Americans that we represent is foundational to restoring trust. I know this is your first time testifying before Congress as director of the CDC, but this hearing is more than a procedural formality. It is a pivotal moment for accountability and reassessment. The insights shared today will not only shed light on past decisions, but will also take a step toward rebuilding trust. This hearing is an opportunity to share how you will apply lessons learned to the current respiratory illness season as well as future decisions by the CDC. Director Cohen, you have an opportunity today to inform the committee and the American people how you plan to lead as director. And we look forward to your testimony and hearing about how you're going to lead the CDC moving forward and restore public trust. Thank you again for being here. Chair Griffith, I yield back.
Thank the lady for yielding back, and now recognize Mr. Pallone, ranking member of the full committee, for his 5-minute opening statement.
Thank you, Mr. Chairman, and thank you for being here, Dr. Cohen, and I look forward to your testimony today and to working with you on all the important issues that the Centers for Disease Control and Prevention is tackling. Particularly at this time of year, it's critical that we make every effort to extend access to vaccines against seasonal respiratory illnesses to all Americans. With new options and new methods of vaccine delivery, it takes a coordinated effort between the CDC, local health departments, and those who are on the ground distributing and administering these vaccines. And right now, COVID-19 vaccines are being distributed commercially and not by the government for the first time since the beginning of the pandemic. The RSV vaccine is also now available for the first time for older Americans, and it's critical that we communicate a clear message to Americans about where and how to get vaccinated to protect themselves and their families from respiratory illness. Now, the CDC has produced a comprehensive campaign to inform the American public about the availability of COVID-19, influenza, and RSV vaccines. Providing clear guidance based on the best available science is core to CDC's mission, and it's encouraging to see you personally contributing to this campaign, Dr. Cohen. But Congress has to also do its part. We must ensure that CDC has the resources and authorities needed to best serve the American people and protect our health and well-being. The COVID-19 pandemic exposed systematic shortcomings in our public health infrastructure and preparedness that we must address. But instead of coming together to advance the bipartisan Pandemic and All Hazards Preparedness Act, or PAPA reauthorization, that applies the hard lessons learned from the pandemic, our Republican colleagues push an inadequate and partisan reauthorization through this committee. And I continue to be astonished and disappointed that we still can't agree on the hard lessons learned during the pandemic. The very title of this hearing shows that my Republican colleagues have disdain for masks, which was an important and effective tool in reducing the spread of the deadly virus. It's unfortunate that a rejection of science seems to have taken hold of House Republicans, and this refusal to learn from the past makes it very difficult to find a bipartisan path forward on necessary and important legislation to protect the American people as we go forward. Over and over again, public health experts have told us that having access to timely data during the pandemic was critical to an effective response. Access to updated, streamlined, and coordinated data is essential in order for CDC to provide recommendations, guidance, and public health information to the general public in a way that is useful and timely. And better health information means better guidance for the public. Unfortunately, our Republican colleagues refuse to include such a provision in their extreme and partisan PAPA reauthorization bill. Democrats, on the other hand, are committed to future preparedness and will continue to work towards that goal. We saw what happened during the early days of the pandemic, and we should do whatever we can to avoid relearning those horrible lessons. And I certainly hope we can have a productive discussion today with Dr. Cohen about her vision and priorities for CDC. We understandably spent a lot of time talking about COVID, but there are countless other health issues that CDC is always addressing domestically and globally, such as maternal mortality and morbidity, the opioid epidemic, mental health, rates of sexually transmitted infections, and shortages in our healthcare workforce. And all of this work depends on good data and a sound public health infrastructure that enables effective communication between CDC and local governments across the country. We have to be able to spot threats early and evaluate the effectiveness of interventions so that Americans can receive the guidance and the assistance they deserve. But Congress also needs to ensure that CDC has adequate resources to do its work. You only need to look at the House Republicans' extreme appropriations bill to see that they are not serious about strengthening our public health system. House Republicans want to cut $1.6 billion from CDC's current funding level. This drastic funding cut would seriously undermine CDC's ability to perform its vital mission and would endanger public health and safety. So it once again shows how House Republicans continue to cave to the extreme elements in their party who have no interest in governing, in my opinion. So it's time for Congress to be a partner, not an impediment, to making important and necessary reforms that make our nation safer. So I thank you, Dr. Cohen, and I'm pleased, Mr. Chairman, that we're having this important hearing today. Thank you again. I yield back.
Thank the gentleman for yielding back. This concludes members' opening statements. Members are reminded that pursuant to committee rules, all members' written opening statements will be made part of the record, but be sure to provide those opening statements for the record to the clerk promptly. We want to thank our witness for being here today and taking time to testify before the subcommittee. You will have the opportunity to give an opening statement followed by a round of questions from members. Our witness today is Dr. Mandy Cohen, Director of the Centers for Disease Control and Prevention. We appreciate you taking your time to be here today and look forward to hearing from you. As you know, if you testify in front of this committee, we generally, I guess always, I can't recall a time we didn't, we take our evidence under oath. Do you have an objection to testifying under oath today? Seeing that the gentlelady has not objected, we will proceed. The chair also advises you you are entitled to be advised by counsel pursuant to House rules. Do you desire to be advised by counsel during your testimony today?
No, sir.
All right. Seeing that she has not requested to have counsel present, would you please rise and raise your right hand? Do you promise to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Seeing the witness answering in the affirmative, you may now sit down. You are now sworn in and under oath, subject to the penalties set forth in Title 18, Section 1001 of the United States Code. With that, we will now recognize Dr. Cohen for your 5-minute opening statement.
Well, thank you, Chairman Griffith, Ranking Member Castor, and distinguished members of the subcommittee. It's an honor to appear before you today. CDC is a critical national security asset, putting data and evidence into action to protect this country's health and safety, and I am privileged to lead this dedicated team. I step into this role acknowledging the unprecedented challenges the agency and the country faced during COVID, and that the health threats are going to continue to impact the security and safety of Americans. As CDC is that trusted and has the tools to effectively and quickly respond to the next public health challenges, and it's foundational to combating these threats. This year's fall and winter respiratory season provides an opportunity to see CDC's core capabilities in action across 3 domains. First, rapidly detect and respond to health threats. Second, provide timely, common sense, evidence-based solutions to protect and improve health. And third, build towards a broader, integrated, effective system that protects the public's health. So first, to be our national security asset that this country needs to rapidly detect and respond to health threats requires faster and more transparent information. And we are already putting lessons learned into action through our respiratory disease forecasts and a new respiratory season website, and that for the first time we are giving a combined view of COVID, flu, and RSV. CDC is taking action to provide timely, transparent updates to help people make informed decisions on how they'll protect themselves and their families against respiratory viruses in their community. You can go to our website right now and see that RSV season is in full swing. The flu season is just beginning across most of the country, though accelerating fast. And while we're seeing relatively low levels of COVID is still the primary cause of new respiratory hospitalizations and deaths, with about 15,000 hospitalizations and about 1,000 deaths every single week. CDC is also leveraging innovative tools to more quickly detect disease trends. For example, in collaboration with state and local jurisdictions, CDC is utilizing wastewater surveillance to rapidly detect spreading disease in communities. Just this week, CDC launched an updated wastewater data dashboard, providing public health practitioners and the public early insights into the spread of infectious diseases in communities. It's data that can be translated into action. Second, we're also applying lessons learned by providing Americans with clear and timely solutions to protect their health. And there's good news. With the approval of new RSV immunizations for the first time, we now have immunizations available for all 3 major fall and winter respiratory diseases. Immunizations against COVID, flu, and RSV remain the safest and most effective protection for avoiding severe illness and death. And I've been traveling around the country talking about the importance of vaccination, answering questions, and meeting with our vaccinating partners on the front lines. Finally, as we build a stronger CDC, it's critical that we build upon and strengthen the infrastructure and systems developed during the pandemic response for a more integrated and effective public health system. CDC must have the public health data system that is integrated with healthcare and our jurisdictional partners. Unfortunately, with the end of the public health emergency, CDC is more limited in our ability to show county-level information for COVID and for other infectious diseases like flu and RSV. Now, CDC is working hard and fast to put in place agreements with our partners to improve access to data at the jurisdictional level and to enable a robust national situational awareness. But even with these agreements in place, and the important enhancements we've made to our data capabilities, absent new policy levers and resources from Congress, there will continue to be a highly concerning limitation in the information CDC can use to protect health security. Further, CDC recently launched the Bridge Access Program to address gaps in vaccine access. The program provides no-cost COVID vaccines to un- and underinsured adults for a limited time. This program is a temporary fix to longstanding barriers to adult vaccination. Without a permanent program, the next time there is a vaccine-preventable outbreak, the country will need to build a system to distribute and administer vaccines to adults who are un- and underinsured. In closing, CDC is committed to protecting Americans from emerging health threats, and to do this, we must be transparent, provide clear communication, and collaborate across government and with other public and private partners. But even as CDC takes concrete steps to achieve these goals, we know we cannot do it alone. We do need help from Congress to support a CDC that has both the resources and the policy levers to be the national security asset we all need. I look forward to working with you on these important goals, and I'm happy to take any questions. Thank you, Chairman.
Thank you very much for your testimony. We will now begin the question and answer portion of the hearing, and I will begin the questioning and recognize myself for 5 minutes. So we've heard a lot in the opening statements, people going back and forth, but even though we want CDC and our health community to give us the data and the science, that did not always appear to be the case during COVID-19. So that brings up my first question. I have concerns surrounding the potential conflict of interest between the CDC and the CDC Foundation, which accepts millions of dollars annually in private financing with minimal reporting requirements or disclosures regarding how these funds are to be spent or whether there are strings attached when those funds come into the foundation. That results in the concern that private donors may be influencing public health policy at the CDC through the foundation. What assurances can you provide us that there are appropriate checks and balances between the CDC and the CDC Foundation, especially when it comes to transparency?
Well, thank you, Chairman. Transparency is very important to me, and I'm working hard to make sure that we can collaborate with many partners. As you likely know, the CDC Foundation is chartered in law, so they exist because Congress asked them to exist. And they are doing work in alignment with the CDC mission, right, to protect the health of this country. Though they do have a separate board and independent way of raising dollars and act independently from us. So we are trying to accomplish the same mission of protecting health.
But I think it's fair to say that you can assure us that you will not allow any donations from individuals to the foundation to affect your sound decisions in making decisions as the head of the CDC, yes or no?
I will continue to make sure that I'm making decisions on behalf of the CDC that are in accordance with the data and the evidence.
Perfect.
From our
I got to move on because time is limited even for the chair of the sub. So, Dr. Cohen, since you have become the CDC director, the level of cooperation from the CDC in response to this committee's oversight has been a little bit disappointing. CDC specifically has not responded to certain letters. Instead, we've received letters signed by HHS Assistant Secretary for Legislation. Even these responses did not respond to all of our questions or provide a single document. Instead, the responses recounted publicly available information. Under your leadership, as you get your sea legs under you, I hope that CDC will work with us to do our role as oversight. Will you commit to working with us and having the CDC cooperate with our oversight for the betterment of the nation? Yes or no?
Chairman, I look forward to working with you. I think it's really important, as I said in my opening statement, that we work closely with Congress, and I look forward to working with you personally. I built relationships across the aisle in North Carolina. I look forward to doing that here in this new role.
Yes, ma'am. Thank you. With the current surge in respiratory disease in China, this subcommittee sent a letter to you just yesterday, so we don't expect an answer yet, but just yesterday regarding this mysterious uptick in cases. Our hope is that, and if you need us to help, we will, but we are hoping that you can put some pressure in an attempt to try to get China to not mislead the world as they did with COVID-19. What steps is your agency taking, is CDC taking, to ensure that you can gather all the complete and accurate data regarding this mysterious uptick in respiratory illnesses in China?
Well, thank you, Chairman. On that, obviously, it is really important that CDC continues to do our global work and do this scientific diplomacy. What we know as of right now, today, of what's happening in China, they are having an increase in some of their respiratory illness. They're seeing it in the northern part of their country. They're seeing an uptick in their pediatric population. What we do know as of today is we do not believe this is a new or novel pathogen. We believe this is all existing, meaning COVID, flu, RSV, mycoplasma, but they are seeing an upsurgence. We do have an office, CDC does, in China, and our officials have been in touch with our counterparts to make sure that we're understanding the situation there. They were sharing back with us, again, not a novel pathogen.
And you'll keep us informed.
We will.
I appreciate that.
Thank you.
According to conversations the Select Committee on China had with local officials of Reedley, California, the CDC refused to take phone calls from city and county officials about that biolab. Why wouldn't the CDC prioritize a call on a serious and potentially deadly issue?
Chairman, we take very seriously working with our state and local partners. We work very closely and collaboratively. And I know in this case, when we were, again, we did not lead the investigation, but when we were invited to join and investigate related to select agents at that lab, we did so. We went on site for 2.5 days and completed that investigation.
Well, what can you tell me about this Ebola refrigerator?
So we did a 2.5-day investigation. We took 300 photos, looked at everything. Our team did not see anything that said Ebola anywhere. Okay. When we heard after the fact that someone said it was labeled Ebola, we immediately followed up and said, do you have a picture? Is there any evidence? Could not produce that. So I think that was an erroneous inclusion in that report. We do not believe that there was any select agents on premises at that level.
Well, it's a dangerous world. Be careful out there. I yield back and now recognize Ms. Castor for her 5 minutes of questions.
Thank you, Mr. Chairman. Dr. Cohen, thank you for your testimony and the important updates on what CDC is doing to educate the public on influenza, COVID-19, and RSV during this season. Having all 3 vaccines available represents great progress in protection against these viruses. It provided me an opportunity to check in with health providers at home, and they are quite enthused about having all of these tools at their disposal, especially the new vaccine for RSV for infants and pregnant women. And I cannot agree with you more about the importance of ensuring CDC has consistent access to timely public health data. When a public health threat arises anywhere in the country, communities cannot mount an effective response if they don't know what's happening on the ground. Quick action in a health emergency saves lives. During the COVID-19 pandemic, Congress authorized and CDC worked to efficiently collect and analyze data from states and localities. But as we learned, spending a lot of time on these processes during a pandemic was a distraction from the missions where we could have been preventing the spread and treating the sick. So that's why I was heartened to see a positive example of a quick and effective CDC response recently in Sarasota on malaria. Can you walk us through how that worked and the importance of data gathering, and then what you all were able to do on containment and prevention?
Well, thank you, Ranking Member Castor. This was, working on the first domestically acquired malaria in 20 years that our country has seen, was, I think, an example of how local, state, and federal officials work really well together. And I think a good news story in that when we identified, again, those first few cases of domestically acquired malaria that we hadn't seen in 20 years, the local leaders were very much on top of it, but were able to reach back to state and then to us at CDC to ask for assistance. We were able to provide technical assistance related to how to control the mosquitoes, how to think about treatment for the individuals. We gave out guidance to the local communities as well as the healthcare providers in that agency to make sure that they were looking for additional cases. We provided some backup laboratory capability for the area, and we also made sure to look at all of the mosquitoes in the area to make sure we weren't seeing further malaria in those mosquitoes. So a partnership here, again, local, state, and federal together. And the good news story is we did not see any continuation of malaria. It's really important to stop it quickly. It was really important to have the data to put out evidence-based guidance very quickly, and to take action, right, to make sure we were spraying for mosquitoes, again, making sure we were taking protective measures. And I think a good news story of saying that's public health at work. Now, public health, sometimes when it's a success, it can be often invisible, right? I bet most folks in Florida don't even know that public health was working for them, but it was. And I'm very proud of the team's effort, again, state, local, and federal together.
And I bet a lot of members here weren't even aware of it, and thankfully, no one lost their life. And think about it in a tourism-based economy, if a public health threat gets out of control or takes off, then it really hurts. It hurts a lot of people. Talk a little bit about RSV. You know, we're used to hearing about the flu and get your flu shot every year. People are all too familiar with COVID, but RSV, why is it more prevalent now, and why is it so important for pregnant women and infants to get the vaccination?
Yeah, so RSV is another virus, a respiratory virus that circulates in the winter season. It really impacts our older adults, our seniors, and our young babies. Babies usually by the age, 2 or 3 years have been exposed to RSV already. We know that because of the pandemic, we did stay home for a period of time, and so there was a cohort of kids that did not get exposed to RSV. And then when we were all having lovely Thanksgivings and Christmases, again, we did see higher rates of circulation, and because children hadn't been exposed to that before, then they were newly infected with RSV. And we know young babies have little lungs and little bronchioles and sometimes get more sick from RSV. The good news for this season, which we haven't ever before had, is a vaccine for our older adults over 60 and an immunization for our infants. It is a long-acting monoclonal, which means we're giving antibodies directly to babies to protect them from RSV. So we are in a different place, but we know that there is a limited supply of that immunization for our babies, so still need for parents to take precautions. And for our pregnant moms, we also have a vaccine for pregnant moms between 32 and 36 weeks pregnant, where they can get vaccinated, build up antibodies, and pass those along to their babies to be protected as well.
Excellent. Thank you. I yield back my time.
I think it's gentlelady in regard to mosquitoes, the Aegis aegypti modified mosquito by Oxitec, which I think is a great control. Not your jurisdiction, but NIH and FDA are working on that. Dr. Burgess, I look forward to hearing your 5 minutes of questioning.
Thank you, Chairman. I don't share your optimism about the FDA and the Oxitec mosquito, but that's a separate discussion. Director Cohen, thank you for being here today. Obviously, your first time before this committee in your role as CDC Director, but it's not your first time before this committee, your role as CMS in previous Congresses. Thanks for talking with us at the Doctors Caucus. We all share the goal of rebuilding the faith and trust in the CDC. I think most of us recognize we need a well-functioning and respected CDC in order to protect the American people. And you've shared some of your vision with us about how we travel that road, but one thing missing is the I don't know, to the degree that there's been self-reflection and decisions made as far as governance and how things work internally at the CDC. Are you free to speak on that?
About the internal work of the CDC, absolutely.
Well, and what you've done internally to change, to modify the culture, improve the culture?
Yes, so this was work, I want to give credit, that started before I came on board as CDC director. They definitely have changed the structure of the agency to make sure it is more operationally focused, so it is more ready to respond. We've created programs like the CDC Ready program where we are training and keeping warm, ready responders who are trained and ready to be deployed if we would see any emergency. But I think now we are really focusing on is making sure that we can turn data into action quickly and making sure that we're working as one team. At CDC, there is a lot of fantastic experts, but often siloed in their disease states.
Sure. Well, let me just ask you, because we are working on the reauthorization of the Pandemic All Hazard Preparedness Act, have you done an after-action report strictly vis-a-vis the CDC? What happened, what went right, what needed improvement that you could share with us? I've asked Dr. Califf the same question. He's promised to do so, but it's not produced. Do you have such a document?
Yeah, so before my tenure, there was an extensive review on how CDC should be reorganized. That was put together as part of what was labeled as the moving forward plan, so we'd be happy to share with your team more details on that.
But just as far as the details of what could we have done better? Do we have access to that?
Well, I think there's been many ways in which we've been thinking about lessons learned, particularly whether we think about the communication space or the lab safety space and quality space. Those are all lessons learned we're already baking into our work, and I hope you're already seeing us communicate differently, both more timely, telling folks what we know when we know it, and also what we don't know. I heard that in some opening statements. So I think we are both communicating differently. I think we have many new procedures related to lab quality to make sure we don't ever see the mistakes on the lab side that we saw before. And we are making sure our workforce is ready to respond. But I will say there are still ways in which we need to continue to work with Congress to make sure CDC is funded to be that national security asset that we need for this country. So there are resources and authorities, again, that we look forward to working with you on.
Well, that always sounds odd coming from a political figure arguing that someone should express humility when talking about something that they're really not sure what's going to happen next. We know it's important, we know it's dangerous, but we don't always know what's going to happen next, or we changed our minds with new data that came in, and that's what was really missing at the helm of the CDC during the height of the pandemic. Again, it seems odd for members of Congress to be lecturing people about humility because it's a quality that we're not known for. Just also on the prestige biotech that the chairman asked about, have we developed a lessons learned and how to prevent this from happening? Or is there going to be an effort created for surveillance of outside labs?
So look, we know we are in unprecedented times with more health threats, and whether those threats come from a lab, from an animal, from a weapon, we need to be ready. And that is exactly why CDC needs to be well-resourced and funded to make sure we are detecting those threats and that we are ready to deploy and respond.
Yeah, but it's not the first time this has happened. We had this same hearing with Dr. Frieden many, many years ago. So it is something that requires some scrutiny. Let me just ask you, I've got the life expectancy increases produced by the Center for Disease Control. It talks about the increases in life expectancy would have been greater if not for the offsetting increases in mortality due to influenza, pneumonia, perinatal conditions. Can you expound upon the perinatal conditions that have contributed to that?
You know, sir, I don't know that I could, but I'd be happy for our team to
If you will
follow
share
up.
that with us, that's important to me, and I'd like to see the follow-up on that.
Absolutely, will do.
Thank you, Mr. Chairman.
Thank you, gentlemen, for yielding back, and now recognize the gentlelady from Colorado, Ms. DeGette, for her 5 minutes of questioning.
Thank you, Mr. Chairman. Thank you for holding this hearing. Most members of this committee know every year about this time, I always say we should have a hearing on flu preparedness, but like everything else in our lives, now it's become much more complex because now we have three things we're trying to prepare for. So, Dr. Cohen, we're happy to have you where you are because we know you're taking this seriously. Back in February, we had a hearing in this subcommittee with some health officials from CDC, NIH, and FDA about the government's COVID-19 response, which, as you heard today, we keep talking about over and over again, but which we really need to move forward to try to be prepared to respond better the next time instead of just whining about it. At that hearing, your predecessor, Dr. Walensky, urged this committee to provide CDC with new statutory authorities so that it could fulfill its public mission. And some of those priorities were priorities you discussed in your testimony today. You need to turn off your mic, thanks. So some of these priorities are ones that you provided in your testimony today, and we were talking about it 9 months ago. So I'm kind of disappointed that we haven't made more progress as a Congress in giving CDC more data authorities, because that's what we really need to be able to identify the issue and then to alert the public. So you can't respond to a crisis if you can't measure that crisis or if you're seeing it in the rearview mirror. And CDC doesn't have the authority to do that without Congress. So, there's this effort to transform the agency that started again with your predecessor, CDC, moving forward. And I know you're trying to move this forward and modernize the data and communication infrastructure. Can you give us an update as to your efforts and let us know what you still need so we can work in a bipartisan way to give it to you?
Thank you, Representative DeGette. Yes, our data infrastructure is critical to making sure that CDC is the national security asset that we need. And a lot of work has been done, and I think there's a lot of success stories. At the beginning of the pandemic, we transmit information, electronically, and only about 200 hospitals were able to transmit that data electronically to that. Now we're close to 30,000, right? So we are making significant progress. As a state official from North Carolina, that data was incredibly important to us, and again, wanted both that information to be at the state level and the national level, because I know that our borders were really important. I needed to know what was happening in South Carolina because Charlotte is right on the border there, right? So having information and visibility across borders is really important, and so we need to make sure that we have a national picture of what is going on, and that is the importance of these data authorities. And we're working closely with our states to do what we can and make sure that we can put all the authorities in place. But having that infrastructure and the authorities, and importantly, the resources are.
What authorities do you need us to give you still?
Well, so I want to touch on resources because I will say in our current budget and the way it looks in the House, they zeroed out investments in data infrastructure. That is just not going to be compatible with a successful CDC. But there's also authorities that allow for us to collect data in a way from both our healthcare partners and our state and local partners in a way that allows us to have that visibility. So we are also happy to work with your teams on how to structure that. We're always talking about data in this case that is de-identified. We're very focused on making sure we're protecting privacy as we make sure to collect this data, but it is really important.
So if you and your team can get back to us specifically with the legislative language. First of all, I agree with you about the resources. If we're going to sit here and collectively say we need to do a better job if there's a new pandemic, we can't zero out your budget for data collection. That's insane, and I don't think that'll happen in the end. But in terms of the legal authorities that you need, if your team can work with us on specific legislative language, then we will try to work in a bipartisan way to make that happen, and I yield back.
Thank you.
Thank the gentlelady for yielding back, and now recognize Mr. Guthrie for his 5 minutes of questions.
Thanks, Dr. Cohen, for being here, and thanks for hosting me in Atlanta and getting to meet your good team. And I will tell you, there are a lot of hardworking Americans in your building trying to make sure we're protected and safe, and we appreciate that. I enjoyed my time there. And as you know, as we discussed, and it gets to, you know, I wouldn't say that I'm whining about COVID. I'm my good friend from Colorado. She is my dear friend. We're not, but we have lessons learned. We lost some faith in a lot of institutions. I'm going to talk about WHO and some others. And I believe you're working to try to do that. And I think we have to work together to try to do that. But just instances that happen, and there's one, it's one of the letters that we had sent to you from the leadership of ENC about the COVID tracker data. I think there were 72,000 deaths that were removed from the CDC COVID tracker website. I think you said it was not you personally, but it was a glitch. There was also CDC's National Vital Statistics System showed less COVID-19 deaths in kids than was previously reported. And so would you explain, I know those are two separate situations, explain those and then what you have done? Because what your group showed me what they want to do with the data. And I believe the people sitting in that room were wanting to use it to give good information for them to protect the American people. The question we have, and we talked about it and other things, is how can we ensure data is being made private? And when you see some of these mistakes and lack of transparency, it's hard to make that case, and I think you want to make it. And so would you talk about those specific instances and then what you've done to fix them?
Yes, well, thank you, Representative Guthrie, and I really appreciated the visit down. You know, making sure that we have timely and accurate information is critically important. And this, I think, when we look at our mortality data or our death data, this is a success story over the course of the pandemic. At the beginning of the pandemic, the way we were able to report death data was quarterly. It wasn't quick. It wasn't in real time. But we know the pandemic was moving so quickly that we had to report more quickly. And so we used a different mechanism to report death data through case surveillance data. It was essentially the state and local folks were collecting that data and would give it to the CDC. We caveated at the time to say this is preliminary. The gold standard, which was not as timely at the time, we were still reporting, but again, it was slower. We made a lot of improvements. Again, thank you to Congress for those resources, where now we can almost get real time in that gold standard data. And that is what we are using, and we were able to sunset those case surveillance data that you were referring to. So we are now in a better place related to our timeliness and accuracy of the mortality. And look, we're still looking at 1.1 million adults that have lost their lives, so there's 1,700 kids that have lost their lives to COVID. So we do have to use all the tools at our disposal to make sure we're protecting folks.
Okay, thanks. And you talked earlier about I was going to ask you about what's going on in China now, and your assessment from what you know is that it's not a novel virus?
Correct. Not a novel virus. Again, we have been in close touch with our counterparts in China, and that information has been corroborated with other counterparts across the U.S. government, but also with our European Union partners as well. So we feel confident that information has been corroborated.
Because one of the institutions that I feel really failed was the World Health Organization. They seem to defend, this is my assessment of it, defensive of China when this COVID broke out, when they were doing the indefensible, not sharing information so the rest of the world could react to it. And they have requested specific data from China for this current outbreak, and specifically recent trends in circulation of known pathogens and so forth. Is China responding to the World Health Organization? I know you have people in China that are dealing with their Chinese colleagues. Do you think the World Health Organization is responding in a way that it should, and do you think China is working with them to forward, from what you can corroborate?
Yeah, I don't know firsthand about the WHO and China interactions. Our information is direct from our teams who are in our China office with our counterparts. But my understanding from WHO is that China has been sharing information related to this, and so again, another way to corroborate.
Okay, thanks. You know, also the World Health Organization asked China for information December of 2022. So I guess just to summarize, I'm about out of time. I know we have our own personnel in China for the CDC, and you feel confident that China's being transparent with them as for the information that you have?
Well, I think, scientific diplomacy is incredibly important in that part of the world. We do have a small office, and we are trying to work on things that are mutually agreeable. But I'm sure we would love to do more work, and I'd be happy to talk more about it.
If it was coming straight from scientists, you're probably different than, I know they have to work through their government as well. But thank you for your work and appreciate, you'll back.
Gentleman yields back. Now recognize the ranking member of the full committee, Mr. Pallone, for his 5 minutes of questions.
Thank you, Mr. Chairman. Dr. Cohen, thank you again for being here to talk to us about the CDC's important work, particularly at this time of year when respiratory illnesses are on the top of everyone's mind. As people are scheduling vaccines to ward against seasonal respiratory illnesses of flu, COVID-19, RSV for themselves and their families, I wanted to know what CDC is seeing in its data about rates of infections, hospitalizations, and deaths. So is CDC seeing a sharper rise in rates of infection or hospitalizations for one of these viruses compared to the others? And what does CDC project through winter in terms of cases, if you will?
Yes, well, thank you, Representative Pallone. So for the first time this season, you can actually see a consolidated view of COVID, flu, and RSV together on our website now, so you can see the relative impact. I would say that we are in full swing of RSV season. We're seeing a lot of RSV, particularly in the southern part of the country. So we're near peak, is what I would say for RSV. With that, we are also at the beginning of flu season. So we're not having an early flu. We're actually having a pretty, what I would say, typical flu season. We do expect to see a lot more flu cases over the course of December and January. So please do make sure that you're getting your updated flu shot and check what's happening in your communities. But that being said, even though those are both going up and we're at the peak of RSV, COVID is still the respiratory virus that is putting the most number of folks in the hospital and taking their lives. So it's about 15,000 people in the hospital for COVID and about 1,000 people dying per week across the country related to COVID. We are seeing an uptick in COVID. Remember, we had a late summer wave of COVID. We came down from that. We are going back up again, which we expect, again, after a lot of travel and gathering at Thanksgiving. But to remind folks, never too late to get that updated COVID vaccine, and as well as making sure that we're getting access to testing and treatment. Really important, because we have treatment for these diseases, to get tested. You know what you have. That treatment, in addition, could save your life.
Now, what about the monitoring of vaccine uptakes across the country for the three, for flu, COVID-19, RSV? What trends are you seeing about the vaccine or uptake?
Yeah, so now that we are outside the official public health emergency, this is one of the issues we were discussing related to lack of visibility with our data. So we don't have the same level of data visibility that we had when the federal government was purchasing and distributing all the vaccines. What we have now is an imperfect tool to know how folks are or aren't getting vaccinated. We use a survey. It's a survey we've used for decades, so it's a validated survey, but we essentially ask folks, did you get an updated COVID vaccine? And from that survey data, we see about 16% of Americans have gotten the updated COVID vaccine, and that's not enough. I'll say that right now. I've been doing as much as I possibly can to be going around the country, meeting with folks, answering questions, explaining the importance of vaccination, but it's not enough, and I look forward to continuing to work with Congress and other partners to make sure that we can help folks know what tools are out there and have them use them to protect themselves.
Well, that gets into the communications issues, so I had two questions about that, and then we'll probably be out of time. What kind of strategies is CDC employing to facilitate communications of your recommendations to the public and to healthcare workers? And how would a modernized data infrastructure or increased authorities to access more timely health data enhance your ability to make public communication more effective?
So first, we are really concentrating our communications efforts with healthcare providers. We know doctors and nurses are some of the most trusted and most important folks who can talk to people about their vaccinations. One of the top reasons people don't get vaccinated is because their doctor or their nurse practitioner just didn't bring it up. So we're really focusing our effort in a time where there are limited funds on making sure that our healthcare providers have all the information they need. As I said, I am going around the country to answer questions. We're working through trusted providers, but we have more work to do. And yes, would real-time data help us to direct our resources? Absolutely. I'll just say, as when I led through the COVID crisis in North Carolina, we used data day to day to decide, should we deploy teams here? Should we increase media in a certain part of the state because we're seeing lower things? So that real-time data is really important to allow us to make sure that we're tailoring our operational work.
Well, thank you so much. Thank you, Mr. Chairman.
I'd like to recognize the chairwoman of the Energy and Commerce Committee, Cathy McMorris Rodgers, for 5 minutes of questioning.
Much of your written testimony focused on CDC's response to the expected trifecta of respiratory diseases this season, influenza, RSV, and COVID-19, as well as your goal to rebuild trust. I hope CDC will learn the right lessons from COVID. I'm growing increasingly concerned about what we're hearing from China. The recent spike in respiratory diseases and clusters of pneumonia reported among children, images of hospitals and schools being overwhelmed with sick children. And it brings us back, sadly, to the early days of COVID-19. The lack of reliable information coming out of China is a troubling parallel to 2020. I, along with our Oversight Chair, Griffith, and Health Subcommittee Chair, Guthrie, sent a letter yesterday to CDC asking about what, if any, interaction the CDC has had with their Chinese counterparts regarding this outbreak. And I appreciate the email that CDC sent last night. I do want to urge you to respond to the letter completely and in a timely fashion, and understand we just sent it yesterday. While I look forward to your response, I'd like to know today whether the government of China has been transparent, forthcoming. Have you spoken with your public health counterparts there? Do you have confidence in their accuracy and completeness of the information that they're sharing? And do you have confidence in the independence of the World Health Organization and its ability to accurately share information out of China?
Well, thank you, Chairman Rodgers. First, just want to reiterate that based on the information we have now, we believe there is no new or novel pathogen, that these are related to existing pathogens, COVID, flu, RSV, pneumonia, and making sure that we are using our China CDC office. So we do have staff from CDC in touch with Chinese officials, our counterparts, and they have been in direct communication. They have shared, the Chinese officials have shared with us that, again, no novel pathogens, that what they're seeing is this. And we were able to corroborate that information across other sources from our European Union partners and others to make sure that we were getting a complete picture.
That's so important, because I have been concerned about CDC depending too much on official announcements from the government of China or the World Health Organization that has proven to be ineffective. I also think it's safe to say that the pandemic broke CDC's guidance drafting process. And leaving aside the disgrace of CDC's collusion with teachers' unions on the school reopening guidance, and the fact that CDC still won't tell this committee what outside groups it consults with when drafting guidance documents. Throughout the pandemic, the CDC struggled to produce timely, accurate guidance and had to regularly revise guidance documents within days of issuing them. The process is clearly broken. Do you believe doing something similar to what the FDA does, which is to use a clear, transparent process for how recommendations are crafted, disseminated, and applied, should be implemented at CDC?
Well, so first I want to say that we want to make sure that we are getting feedback, and I have already talked to our team about how we need to make sure that we are marrying evidence-based solutions with what works on the ground. As a state official, I want to make sure that the guidance that we are providing from CDC works for our states. Stakeholder engagement is a core component of what we need to do. Right now, we have guidance that is posted on our website for public feedback for all to do, but there are certain circumstances where we need to work quickly. Actually, the example of malaria that we responded to in Florida required us to move very rapidly and put out guidance for those communities in a rapid way. So
Okay,
there
thank
is.
you. Thank you. I have one more question I want to get to here. because I do believe that this is fundamental, that we need good guidance practices. The FDA did this over 25 years ago. I have a bill that would require CDC to enact good guidance practices, and it even includes a provision allowing the secretary to waive those practices in an emergency. So unfortunately, the CDC is opposing this bill. So we've seen how CDC guidance can affect millions of American everyday lives. The FDA already uses a similar approach. Why shouldn't the CDC?
Well, I don't think there's a one-size-fits-all for the kind of guidance that CDC offers. Sometimes, like this example for malaria, it wasn't an emergency, but we did need to move quickly to prevent the emergency. Other times when we have the time, like we have right now, we have some guidance up on our website for feedback. I hear the intent of what you want, which is to make sure we're hearing feedback both from Congress and other stakeholders. It's very important to me as well. So we want to bake that in. I don't think there, like I said, there's a one-size-fits-all for that process, but I hear you on the intent and very much hope we're already showing you that we're fulfilling that.
Well, I want to work with you on this. I believe good guidance is really important, and it would go a long way toward building trust that has been broken. So I yield back.
Thank you.
And now I recognize Mr. Tonko for 5 minutes of questioning.
Thank you, Madam Chair. Seasonal RSV typically causes mild cold-like symptoms, but in some cases, the virus can cause serious illness and hospitalization. Infants and young children are at a particularly high risk of serious illness from RSV infection, as we heard here today. This is the first year there's an RSV vaccine for the youngest children, which is an incredible advancement. So, Dr. Cohen, what do parents need to know about the current RSV season, and what steps can they take to keep their kids healthy?
Well, first, we want parents to know that our youngest can be impacted by RSV, but there is a new immunization. So also, if you're a pregnant mom, to know if you're between 32 and 36 weeks, there is a new vaccine for you that allows you to pass on your antibodies to the baby and protect your baby as well. So new tools that are out there, but remember to make sure you're in touch with your pediatrician about getting access to them.
Thank you. In my district, I know that parents have heard CDC's message to get their children vaccinated. They're attempting to respond, and there's high demand. Unfortunately, parents in my district are having trouble finding the vaccine due to shortages, which I know CDC is aware of. I also am hearing from many constituents about access issues for COVID-19 vaccines for children under 3 years old. For example, an individual I'll name just as Heather from Delmar, New York, contacted me and shared that she had been trying to find a vaccine for her 2-year-old child, but that there were no such options available. The closest location that would offer the vaccine to children under 3 was nearly 2 hours away in Hartford, Connecticut. I'm also hearing about access issues for the RSV immunization for children and pregnant individuals. A mother from Albany, New York, shared that her toddler has asthma and is considered at a more severe risk for infection complications, yet the immunization is not available locally for her son. In response to these calls from constituents, I reached out to 2 of our colleagues here in Congress who are both pediatricians, Congresswoman Schreier and Congresswoman Caraveo. They shared my concern for the health and well-being of many of our youngest and most vulnerable constituents. With that in mind, this week we joined together to send a letter to CDC on pediatric vaccine access. And Madam Chair, I ask that we enter this letter into the record, please. Thank you, and I look forward to a complete response to this letter. But in the meantime, I have a few questions for you specifically in regard to the RSV vaccine. Dr. Cohen, how is CDC working with FDA and manufacturers to respond to this supposed shortage of pediatric RSV vaccines?
Well, thank you, Representative Tonko. We have been working very closely with manufacturers. I personally have been on the phone maybe dozens of times with the teams to work to accelerate the supply. The good news is we actually were able to have about 70,000 additional doses accelerated. We do expect additional doses in the January timeframe, but there were manufacturing delays here. And so what CDC has done, in addition to working with the manufacturers, is to put out guidance to make sure we are using the supply that we do have, and we have many hundreds of thousands of doses, but that we do use those doses for the highest risk children, and making sure that, for example, those who are under the age of 6 months are even at higher risk, and make sure that they are getting prioritized for these doses.
Well, I appreciate that, and it's so important that you're taking it so seriously. In addition to what you've just indicated, is there anything that Congress should be doing now to help alleviate current and future pediatric RSV vaccine shortages?
I appreciate that question. I would probably need to get back to you on what would be most helpful. We're working through that right now, and as I shared earlier, the RSV immunization is a long-acting monoclonal. It is a different production cycle than a traditional vaccine. It takes longer. There are decisions needed right now to make sure even next season that we are in an adequate place that we're working with the manufacturers on. So let me take that back to the team and see if there are other things we need to deploy here.
I appreciate that. The work that CDC does every year to educate Americans and help them prepare for seasonal viruses like RSV is indispensable. It is encouraging to see such strong demand for a new vaccine, and I look forward to working together to make certain that you have the resources you need to continue CDC's important work. We appreciate the public information efforts. They're incredibly important. And with that, Madam Chair, I thank you and yield back.
And now I'd like to recognize the gentleman from South Carolina, Representative Duncan.
Thank you, Madam Chair. Today's hearing, Director Cohen, is fundamentally about understanding your priorities as director and how you're going to lead CDC. Dr. Cohen, as Secretary of North Carolina's Department of Health and Human Services, during the COVID-19 pandemic, you mandated that students in K through 8th grade wear a mask regardless of their vaccination status, and threatened to sue school districts that refused to comply. You imposed the school mask mandate after Governor Cooper, whose administration you work for, vetoed a bill that would have required in-person schooling. You've also spoken publicly that you made decisions on whether to allow fans to attend football games or whether to lift mask mandates based on feelings and what your friends at other state public health agencies were doing. None of this suggests that you will push for the much-needed changes at CDC or help the agency break from its insular culture. I'd like to ask you if you have any regrets about the school closures, the mask mandates, or any other restrictive measures you imposed in North Carolina.
Well, thank you, Representative Denton. I'm very proud of the work that we did in North Carolina. I feel like we did that in a way that was very inclusive. We listened. I had great partners on both sides of the aisle in North Carolina as we did that work. You have to put yourself back in 2020 when we had very little information. We barely had any tests. We had very little PPE. We certainly didn't have vaccines or treatment. There were very few tools at our disposal to protect folks.
Would you impose those type restrictions today?
Well, the good news is we're in a new place. So, right, and I'm looking forward to turning this new chapter with CDC as we look forward. I want to make sure we're learning the lessons from the pandemic about transparency and about creating those infrastructures that we need to make sure that we can detect and respond to diseases. But I want to make sure that we are in a place where we don't have to get into that place again, right? So we are a detecting.
We trust the
responding
science
to
and
that.
not the feelings and the opinions. A lot of it was subjective, the 6 foot social distancing and all this. But anyway, moving on. We had a hearing at CDC on CDC reform back in June, just after the COVID-19 public health emergency declaration was finally terminated. Some of the major takeaways I had from that hearing is that CDC is much too academic, too insular, and does too much. To be fair to you and the CDC, a lot of these failings have their roots here in Congress. CDC has never been authorized as a coherent agency. We in Congress have never told the CDC definitively what it's supposed to do and what it isn't supposed to do. This has led to mission creep, and CDC, a CDC that is an agency of all trades but master of none. So I think the lack of underlying authorization is the root of a lot of CDC's problems. We in Congress need to revisit CDC's authorities to impose mask mandates and vaccine mandates. Some of these statutes date back decades and were originally given to the Surgeon General, who is now just sort of a glorified spokesman for the nation, These authorities are totally out of date and prior to COVID-19 were thankfully seldom utilized and never at the scale we just experienced. Dr. Cohen, it's a tragedy that CDC pushed vaccine, mask, and distancing mandates on the constituents of the 3rd District of South Carolina and all across the nation that closed small businesses, schools, and places of worship. And it's worth noting that these same restrictions were not applied to protests and riots that we saw all across the country. We owe it to the American people to provide coherent direction to CDC. Congress owes that to CDC as well. Set clear boundaries on your authority. And as I close, I'd encourage my colleagues to read the report I'm going to request be entered into the record by the Heritage Foundation. It provides what I think is a realistic roadmap that we can that can set us on a course to fix the failures and overreach we saw during COVID-19. Mr. Chairman, Madam Chairman, I would ask to enter that into the record. And thank you for your leadership and for holding this hearing. Dr. Cohen, Director Cohen, I wish you luck at CDC as you face these challenges. We're not here to thwart your efforts. We want to define your mission and help you to keep America safe, but do it in a very pragmatic, common sense, science-based way. And with that, I yield back.
Without objection, we'll place that in the record. And now I call on Mr. Ruiz for 5 minutes of questioning.
Thank you, Dr. Cohen, for being here and for taking on the incredibly important role as CDC Director. I serve as ranking member of the Select Subcommittee on the Coronavirus Pandemic, and I believe that the value of looking back at the government's response to the pandemic is to be more prepared going forward. So, Dr. Cohen, what are the most important lessons to take away for CDC and the public health system from the pandemic, and how are you applying those lessons? And I know you've talked a lot about it, so let me ask it in a different way. If you were to choose one thing that could make the biggest difference, what would be on top of that list?
Well, thank you, Representative Ruiz. It's always hard to choose just one because, look, this is a hard amount of work, and I certainly bring a lot of lessons learned from North Carolina. Maybe I'll focus on operational excellence. I think it's really important to pair the science and the evidence and the data with execution, meaning the ability for us to deliver for the American people a response effort or a vaccine distribution that is effective, and so making sure that we have systems that work. Certainly we've talked a lot about data, but having systems that coordinate between federal, state, and local, and that we have that the infrastructure to make sure that we are delivering for the American people. So I see CDC already moving in that direction, and what I mean by that, we're not just putting out recommendations related to vaccines, we're putting programs in place that allow people to get vaccinated. For example, the Bridge program. This is a program stood up, first time, very incredible heavy lift for CDC to stand up this program so quickly, but is offering free vaccines for the un- and underinsured across this country. And so that's the kind of work we need to pair with the good data to say that these vaccines are safe and effective. We also have to break down barriers of cost and access at the same time.
And so as you begin your tenure at CDC, what should our priorities be in Congress to improve the nation's readiness for a future health emergency?
Well, thank you for that. I think a partnership with Congress is so important. We've talked a lot about needing the resources and authority to be the national security asset that we need, but I'll also say it's really important that we align to share good information about tools folks can use to protect themselves. We know that folks want to leave COVID in the rearview mirror, but it is still here with us, and it is important to have a shared voice saying, hey, use these tools that are safe and effective. I'm certainly going around the country doing that. I'd love to have more voices join that chorus. But again, the communication is important, but we need those resources and authorities that allow us to do our job well.
And some of our Republican colleagues have raised concerns about CDC's Federal Select Agent Program and CDC's inspection of a facility in Reedley, California. Can you explain the role of the Federal Select Agent Program in biosafety? And is there anything you would like to clarify on the CDC's response to reports about the Reedley facility?
Well, thank you, Representative Ruiz. You know, the report that was put together on this did have a number of inaccuracies, and I do want to make sure we're clarifying that the investigation was run by state and local officials in California. It was run by FDA, FBI. CDC was brought in, to your point, around select agents. We were asked to join on site to investigate, could there be select agents on site. Our team was there for 2.5 days in an extensive review, took hundreds of pictures. We looked at invoices, we looked at freezers, and what was actually very notable was the absence of equipment that you would normally see if there were select agents. So whether it was protective equipment or safety hoods or what have you, none of that existed at this lab. And after that extensive review, you know, our team did conclude that there were no select agents on that property, and then again turn the investigation back over to the FBI and others who were in charge.
Thank you. You know, we face challenges in rural and underserved communities in getting public health information to them. What are some of the most persistent obstacles that CDC faces in getting public health information to hard-to-reach communities, and what strategies does CDC employ to try to overcome these obstacles?
So it is very important that we are reaching every community. I believe no matter what zip code you live in, you should have the opportunity for health. I think our most important tool here is partnership and trusted partners. So there are trusted partners that we work closely with who already are known by their community, trusted by their community. And again, we're focused a lot also on making sure our health providers have the information and tools. We know that they're trusted, doctors and nurses, and those are folks that we want to make sure we're partnering with.
Thank you.
Thank you.
Thank you, and now I call on myself for 5 minutes of questions. Thank you, Director, for coming to testify, and thank you for meeting with me in my office the other day. In addition to this committee, I also serve on the Select Subcommittee on the Coronavirus Pandemic. The CDC is obviously important to the health and safety of Americans. And unfortunately, I think all of us know that the confusing and inconsistent recommendations coming from the CDC during the COVID pandemic have really damaged Americans' trust in the CDC, and we want to rebuild that. Vaccine and mask mandates implemented by the Biden administration and states have caused long-lasting distrust in the trust us, the government knows best what's for you mentality. I have been told that while you served as the Secretary of the North Carolina Department of Health and Human Services, you were a staunch proponent of vaccine mandates, extending school closures, and business lockdowns and closures. Is what I have been told accurate? And if so, how do we know you won't support government mandates at the federal level?
Well, thank you, Representative Lesko. And, you know, I appreciate that we're looking forward. We want to turn that new chapter. I think there are a lot of lessons learned from the pandemic. We've been talking about them today. And you have to remember, at different moments in time, we needed different solutions. And the good news is we are in a different place, and we can look forward as we go to make sure that we are building the national security asset that we need. And so we want to use tools that protect folks' health. Vaccines are a very important tool to protect folks' health. It's why I've been traveling around the country sharing that. But I am trying to take those lessons learned, apply them, and move us forward.
Well, hopefully you'll take those lessons if another pandemic breaks out while you're still the director. Because I oppose government mandates. I myself took the vaccinations, but I don't think it should be forced on people. And with that in mind, do you think that the government mandating vaccine mandates, it actually did the opposite effect and made people more hesitant to take them?
Well, I think vaccines are a critical tool to keeping folks healthy and safe. And it's not just the COVID vaccine, it's flu, it's all of the vaccines that have kept children and people safe for many, many decades. I think they continue to be really important tools, and I look forward to working with Congress to make sure that we can get good information to folks so that they can make the choices for themselves to use tools to protect themselves.
Well, I can tell you from personal experience talking to many constituents, the mandates actually had the opposite effect on people. Less people want to take vaccines. I think it's a better approach to encourage people to take vaccines, not to force it on them from the government, because then people just will distrust it. Not all people, but a lot of people. My other question is, do you believe that wearing cloth masks or the surgical mask, I'm not talking about the N95 mask, the surgical mask prevented people from getting COVID?
Well, thanks for that question. We know that masks work. They do work, the surgical masks work to make sure that you're protecting you, the individual, from circulating viruses. So they do work. And again, at different points in time, they were some of our only tools that we had before we had reliable tests or treatment or vaccines. But they are still a tool that we can use. But don't forget washing hands, ventilation. We learned a lot during the pandemic. We need to use all those tools.
So you believe that some of those cloth masks that people had, where the openings and the cloth is bigger than the molecules of the COVID vaccine, actually prevented people from getting COVID?
Well, so surgical masks are certainly better, and N95s go, even better than that. But cloth masks still provided some barrier to folks, but that's not, when CDC makes its recommendations about what kind of mask to wear, we say wear a well-fitting, appropriate mask, yes.
I hope that the government balances the benefits versus, for instance, in school children, having all school children mandated to wear masks when perhaps those masks' benefit did not outweigh the negatives of children not being able to see lips moving or expressions and that type of thing. Thank you. Go ahead.
Oh, I was going to say that is where we relied on the American Academy of Pediatrics related to safety of masks for kids, and they continue to say that continues to be a tool that we can use to make sure folks are protecting themselves.
Thank you. And now I call on Representative Tchaikovsky for 5 minutes of questioning.
Thank you, Madam Chair. I am so happy to welcome you, Dr. Cohen, at your first hearing right now, and I want to wish you the best of luck. And I want to also say that I am so grateful that you have hit the ground running. I know that you have been all around the country, that you have been encouraging people to get vaccinated, and that you have been fighting vaccine misinformation. I know that you were in my city of Chicago. I appreciate that very much. I have focused on older Americans and their health care needs throughout my career, and I am concerned about what is happening right now in nursing homes and in assisted living places, where we see, according to your agency, that in fact that the numbers of seniors who are right now being vaccinated is quite low. And in fact, there was a study that found that only 20% of the people in nursing homes right now have gotten the vaccines that they need. Before I turn to you, I just want to say that we also rely on staff. Mm-hmm. And the CDC does require staff to understand more about being vaccinated and to pass that on. But we are concerned that some of the staff are not encouraging people to get the vaccines. Could you reply to that?
Well, first, thank you, Representative Strakowski. We too share your focus on seniors and making sure that they are vaccinated. We continue to see in our data that those over 65 are at the highest risk of hospitalization and death from COVID, flu, and RSV. So it is important that folks are getting access to these tools. I want you to know that we have been very focused on engaging the long-term care community and leaders. We had a summit at the White House bringing folks together to understand barriers, and we continue to have weekly calls with folks to say, how can we help and overcome any challenges? And I have spent at my time as I've traveled around the country to visit some nursing homes, a particular few that have really high rates of vaccination, to understand what are those best practices that we can share around the country. I was in a nursing home outside of the Philadelphia area, Statesman nursing home, where they really used their love of the football Eagles to help them with their vaccination efforts, right? They made it a little fun because, look, we understand that folks are a bit fatigued from vaccines, and so by thinking about creative ways to get folks vaccinated, and I appreciate you bringing up the staff, because it is important for the staff themselves to get vaccinated. So we need to be working not just to get, of course, our vulnerable seniors, but also those who are working closely with them. So we have been working closely to make sure we're thinking about both communities to get vaccinated.
Thank you so much for that. In the remaining time, I wondered if you could tell us, looking forward, what your priorities might be. I'm not just talking about the issues that you want to confront, but perhaps also the management of the CDC.
Well, thank you for that opportunity to talk about the future. You know, I shared that we really need to make sure, again, that we are identifying and responding to health threats, that we are making sure that we're giving evidence-based but common sense solutions for folks to protect themselves. But I want to spend a little time on how we create a system that brings health delivery and public health closer together. I think silos were not our friend during the pandemic, and I'm working hard to make sure that we are bringing CDC and public health, state and local, closer to our health delivery system. Now, I want to make sure I don't lose the opportunity to talk about the importance of the public health workforce and needing people to be experts and do this work as we go forward. So making sure that we are training the next generation of experts in public health, but that does require us to continue to work with Congress to make sure we have the right authorities to bring in the talent that we need as we go forward. So a lot of work ahead to build an integrated way in which we're bringing health delivery and public health closer together, that we tie that together with data and other mechanisms, but we need the people who are the experts to make sure we can carry out our mission.
Thank you so much, and I yield back.
Thank you. And Dr. Bashan, just so that you know, our rules say that Mr. Peters has to go first. So I call on Representative Peters for 5 minutes of
I love going
questioning.
in front of Larry. Thank you, Dr. Cohen. I have to say, we had a really great conversation the other day, and I was excited about, you know, I think I was frustrated with a lot of people about CDC's communication, and I'm very indulgent because I know that, gosh, we didn't know anything. We didn't have any tools, and I thought that throughout the whole process, looking back, it would have been useful to share more of the uncertainty along with people as we went along. I think they would have appreciated that. And I think you just made a mistake in this testimony in that I wanted a clear answer to a question, do cloth masks work? And you gave me an answer as a lawyer that I had a hard time understanding. And I think it's a fair question. And I guess I wish that you had just said, don't use cloth masks, use the surgical masks. Don't we have enough information to answer the question like that?
Well, so I want to make sure that we are saying that cloth masks are a barrier. meaning that they do work in some, but do surgical masks work better? Absolutely, right? Would I wear a cloth mask? No, I wouldn't. I would wear a surgical mask.
It's still pretty complicated. And my district is, I think, the 10th best educated congressional district in the country. My neighbor would say, should I wear a cloth mask? I don't know from your answer of what I should tell them. What I would say is, you know, I don't know what to tell them. So I guess I'm a little bit frustrated with the still a little bit unclear response from you about a simple question. But let me ask about a complicated thing, which is data. What would you tell my neighbor about the importance of having good data at the federal level to help us inform how to prevent something like this from happening again, or how to address it as it happens?
Sure, but I want to be clear. Wear a surgical mask. So wearing a well-fitting surgical mask. But on the data side, it is really important to have a national picture of what's going on. I think we've made a ton of progress in that way. I mentioned actually a new data visualization around our wastewater data. I think that is going to give us some really interesting look at some early signals about what's happening in communities all across the country. And the reason we need a national picture, I mentioned, I led the COVID response in North Carolina. Charlotte, one of our biggest cities, is on the border with South Carolina. It was really important for me as a public health official to understand what was happening in South Carolina, to understand what would happen in Charlotte.
Back that up a couple steps. Why is that important? You say it's important. I think I agree with you. Why don't you explain why is it important for you to have information? And what information did you need to have to make a response?
Yeah, so having that information allows us to deploy different.
What
I'm sorry.
information?
Depends on what we're talking about, whether it was how many people are vaccinated in an area, how many tests were we seeing people get access to. If I could see certain neighborhoods that weren't getting as much testing or as much vaccination, I could deploy at the state level different kinds of teams. We also had information, at the height of the pandemic, where ventilator use was, and that was an important point related to South Carolina, because there were multiple times where North Carolina had to share some of our ventilators with South Carolina. So knowing where our ventilators were and how we could be sharing resources was really critical.
So I've been long wondering what we could do in Congress to support better data at the national level. I know the administration has taken on a data modernization initiative. I think that's great. It needs to be funded. What is left to be done in that initiative, and what do you need from Congress in addition to funding?
Thank you for that. The funding is critical, and we want to make sure we're moving forward. But in terms of authorities, we have really scoped out something that I think allows us to do even a pilot is a step forward here. So we have some concrete language, and I'm happy to have our team share with you that we've been working on, particularly with some of our Senate partners, about how we can think about a data authority that allows for collection of data beyond COVID to make sure that we're getting the information we need to respond quickly, to your point, to deploy different kinds of tools based on what we see in the data.
Do you have legislative ideas for us that we need?
Absolutely.
Okay. Well, I'd love for you to share that with us. I think we all want to make this work better. I want to say again, look, we started this, we were really vulnerable as a country. We didn't have even PPE. We didn't have a lot of science. I think one of the ironies of this whole discussion is that one of the great achievements of the Trump administration was the warp speed creation of a vaccine really fast. They don't want to talk about it now because they're sort of anti-vaccine. It puts them in a tough spot, but I would like to know what positive lessons we can learn from that to make sure that we get that we're ready the next time. And I hope that you'll be very forthcoming about the funding needs you have, which will be smaller at the front end than they are in the middle. We lost a lot of, we spent a lot of resources dealing with this. I think that was the right thing to do in the circumstances, but let's make sure we're not caught unprepared next time and have to do that again. I yield back.
Now I recognize Dr. Bouchon for 5 minutes of questions.
Thank you, and thank you, Director Cohen, for being here today, and thanks for recently coming to the GOP Doctors Caucus. I very much appreciate it. Your job isn't an easy one. You knew that coming here, though, right? Yet you've taken on the challenge, and I have a great deal of respect for that. I want to quickly follow up on what Mr. Peters said about data. The key is making it clear to the American people this is de-identified, non-person-specific data. That's the challenge I have in rural America. People just don't trust the feds on this, and we have to make sure that we do that. And I agree that we need better data. As I've discussed with your predecessor, Dr. Walensky, As a physician myself, political influence must be removed from the decision-making at the CDC, and I've mentioned that to you at Doc Caucus. This has happened recently under both Republican and Democrat administrations. We're all aware that a substantial percentage of the public has lost trust in the CDC, and we can agree or disagree on how exactly that happened or what the implications may be, but I believe all of us looking forward can agree that something needs to change if the agency is going to be effective at combating the spread of communicable diseases, as was its original mission. Let me remind everyone, the CDC was established in 1946 as the Communicable Disease Center, the CDC. It was born out of the goal of preventing malaria and typhus in southeastern states. The CDC has been the preeminent organization in the world on these issues for decades, and still is, in my view, even with the challenges created by what I consider overbearing political influence. With that statement, I want to talk about specific communication and how we communicate and convince the American people that we're making progress here. On the communication side, do you have specific actions you've taken or do you plan to take to get to the American people what the CDC is doing and why?
Well, thank you, Dr. Prashant, for that. And yes, I hope you are already seeing the CDC communicate differently. First, we've overhauled our website where people do come, and there's more to come with that as we continue to consolidate the information so it's more usable, people can access it more quickly. But we're also communicating in different mechanisms. So, for example, when there was a new variant that we saw in August, we immediately put something out to say, here's what we're seeing, here's what we know, and here's what we don't know. I think that was brought up earlier. So we're trying to rapidly communicate, and we're trying to use different mechanisms to communicate. So we're trying to make sure that we are meeting folks where they're getting their information. They're not coming to our website necessarily for information. We have to go to where folks are, whether that's using social media or others. So you're seeing me post a lot more videos. So we recognize that some folks want to watch a short video to understand a complex topic. So I think there's a lot of ways in which we're changing up how we're communicating. But we're still going to make sure that we are focused on bringing the best evidence and data to that, but make sure that it's simple and timely, as well as work on the ground for real people.
Yeah, because as you know, as political people like ourselves, communications is key, and that has changed dramatically over the last 10 years, right? And if we're behind at an agency, you just don't reach most of the people. You have to be on social media. You have to do, to your point, go to where you can reach people. I have adult children. None of them watch the regular news. None of them. They get alerts on their phone, whether that's on Snapchat, whether that's on Instagram, X, all of those, and I'm hopeful that we can do that. Who do you seek guidance on to help you do this? I mean, who's helping? Is it, I would argue that maybe it should be Madison Avenue.
Well, first, you can already follow me on Insta, but we have brought in, additional folks to make sure that we're modernizing how we're thinking about communication, and so I think we still have work to do, but yes, important.
Do you have an internal, does the CDC have a robust internal communications and public relations department specifically to address this?
Yes, sir. We have a communications department. It's under new leadership. I think they're doing good work, but we're not all the way there. We have more work to do.
Okay, I appreciate that. And you're aware of the CSIS report on
CSIS, yes, sir.
This report.
Yes, sir.
Yeah. There's a lot of good things in there. It was a bipartisan commission. I know that Dr. Walensky and I talked about that. We actually had a meeting over at CSIS here in town. Dr. Walensky was there. There's a lot of good ideas in there, bipartisan. I just encourage you to use this as a resource along with your internal moving forward program. Thank you.
Thank you.
Now I recognize Representative Dingell for 5 minutes of questioning.
Thank you, Madam Chair. It's good to see you here, and thank you for coming in and testifying on this important topic. As you know, the coronavirus pandemic did upend our nation, and it strained our healthcare system, stunted our economy, disrupted children's learning, and no community was left untouched. It was the worst public health crisis we've experienced in a century, and you've come into the CDC at a time of turmoil, unrest, etc. And even as we continue emerging from the pandemic, COVID-19 is still with us. I say to everybody, we may be done with COVID-19, but it's not done with us. And we continue to see infections. It's fundamentally changed our nation, and we're still dealing with many of the consequences. Today, one of the problems we still have is we continue to witness significant distrust of our public health institutions, like the CDC, unfortunately. So, one of the questions I keep asking myself, how can we expect Americans to make the best decisions to protect themselves and their loved ones if they don't have confidence in our leading public health institutions? So I was going to ask some of the same questions my colleague just did on some of the communication issues. I know you're making this a priority, and I'm going to reinforce and maybe do a few more for the record, that it becomes really, really important, because one of the things that I'm very concerned about, we're hearing an uptake in respiratory cases. People aren't getting any of their vaccines. There's a distrust of all shots, of all, not only the COVID-19 vaccine, but the flu and the RSV. Why is it so important for people to get the latest COVID-19 vaccine and these other immunizations as well?
Well, thank you, Representative Dingell. You know, I've been traveling around the country sharing with folks about why to get the updated COVID vaccine. It's really three reasons. One, the virus has changed. So in the same way that the flu virus changes year over year, we've seen the COVID virus change. And you want to make sure that the protection you have is matched to the way the virus has changed. Second, whether you've had COVID before or you've been vaccinated before, that protection decreases over time. And you want to make sure you are boosted up to the highest level of protection you can going into a time when we know we will see more COVID circulating. And third is about reducing the risk of long COVID. We are still seeing 1 in 7 adults have extended symptoms, even from a mild case of COVID. No one wants to be sick for a short time, certainly not for a long time. And so for those reasons, we are encouraging folks to get the updated vaccine. It is why, when we look at the data, there is not an age group that doesn't have some increased risk from the COVID virus. Certainly, our seniors are at the highest risk. So those who are over 65 are at the highest risk of hospitalization and death. But our vaccines can prevent them. And I know we've been focused a lot on vaccines, but I just want to mention treatment again. We do have treatment for COVID and for flu, but you have to know you have it, which means you need to get tested. We are offering free COVID tests at covidtest.gov. We want folks to make sure they're ordering those tests so that they can get treatment.
So let me ask you a quick question. On top, there's a lot of misinformation out there, and a lot of people are still afraid to get all of these different immunizations. Getting back to the communication issue, how are you combating misinformation?
Yeah, so in order to combat misinformation, one, you just have to get a lot of the good information out there, and that means we have to partner with folks who are trusted. So whether that's doctors and nurses, and that's where we've been focusing a lot of our efforts, is to make sure our doctors and nurses and other healthcare professionals have what they need, but also whether it's the faith community or others to help get good information out, and I include Congress in that as well, to help us get good information out to communities to make sure that they hear the good information, the accurate information, so they can make choices for themselves.
So you're almost out of time. I may do some questions for the records, but since we only have less than a minute, is there anything else you want to add about the work you're doing?
Just that I think the CDC is on the right path, but we have more work to do. And I recognize that we do need help from Congress to make sure that we are well-resourced and have the authorities related to data and workforce. We talked earlier about the importance of making sure that we have a vaccines for adults program as well. We have a vaccines for children's program, but do not have something similar for under or uninsured adults. So all of those things I look forward to working with Congress on.
Thank you.
Thank you.
I yield back, Madam Chair.
Well, Director, you're so popular that more people have showed up to ask you questions. So now I recognize Representative Palmer for 5 minutes of questioning.
I thank the gentlelady. Director Cohen, can you name 3 things that you would do differently from the former director of the CDC?
Thank you so much for that question. As I was sharing earlier, I led the COVID response for North Carolina, and I think the lessons that I bring from that are 3 of them. One, a focus on transparency. I think transparency is really important to build trust. I think sharing what you know when you know it, and also what you don't know. I hope you see that already under my tenure and how we're communicating differently. So that is one. Second is a focus on operational excellence. We can't just recommend a vaccine. We have to make sure that we're making access possible for folks. We need to marry the evidence with the operations. We are an operation response agency as well. So that's number 2. And then the third is about relationships. It's really important that we are working as one team. We have to build relationships before a crisis hits so that when we get into those crisis, we can make sure to use those. Sometimes public health finds themselves siloed away from the traditional healthcare system. I think it's really important that we bring healthcare and public health closer together.
Well, if the CDC had a sales department, those would all be fine. I'm talking more about actual policy and specifically, would you have shut down the schools? Would you have closed the schools? Is that what you did in North Carolina?
Well, sir, yes, back in 2020, all the schools across the entire country were shut down, including North Carolina. But I did work across the aisle with...
Would you shut them down? Had you been in charge, would you have shut down the schools if this were to happen again? If we had another major respiratory outbreak, would you shut down the schools?
Well, the good news is we're in a different place than we were before. We both have different tools and different mechanisms to respond. So I can't really address a hypothetical, but I do think we've learned a lot about how to approach things.
Did it
going
harm
forward
our
in the future.
students by shutting down the schools?
Well, look, we always knew in-person instruction was incredibly beneficial, not just for
You'd be great in
education,
the
but
sales
for-
department. But I'm trying to get to policy, and that's one of the key things that troubles us about the CDC, is that we have to address policy. You know, there's a saying that if you're explaining, you're losing. So we need to get down to policy. We need to talk about the things that went wrong and what we need to do. Masking, you know, you keep... the CDC insisted on masking kids as young as 2 years old and made the argument that there was no disagreement. I think the word is equipoise. I have a study here that clearly shows that there was widespread disagreement in Europe, even here. Yet the CDC insisted on masking kids as young as 2 years old. What would be your position on that?
Well, I would say it's good that we're in a different place and we're able to turn a chapter forward. We have a lot of different tools to protect our children now, vaccines and treatment. Masks continue to be one tool amongst many that we can use to protect ourselves.
So you would continue to require masking for 2-year-old kids?
So, again, we are in a very different place. than we
I
were
know
before.
that, but I'm asking you, this is a policy question. There have been no randomized control trials on masking. And I can't help but think that the CDC didn't want the randomized control trials because it didn't fit the narrative, didn't fit the position they wanted to take. And there's a lot of people, I mean a lot of people, that felt like this was more about power than it was medicine. And if you're going to continue to try to do a sales job, you want to continue to try to explain positions, it's going to be difficult to get us on board with the CDC because people don't trust you anymore. And there's been enormous damage done to science and medicine by the policy of the CDC and the National Institutes for Health and others, Dr. Fauci being the lead candidate for disinformation. So you can continue to come in and do a sales job. You can try to explain. But if there aren't significant policy changes, I think it's going to be very difficult going forward. I yield back.
Thank you. And now I call on Representative Crenshaw for 5 minutes of questioning.
Thank you, Madam Chairwoman. Thank you, Dr. Cohen, for being here. I echo what my friend Mr. Palmer said. If the CDC wants its credibility back, you've got to have a mea culpa moment. You're in the perfect position to do it because you had nothing to do with their decisions at the time. So there's no reason to defend it. The data is the data. The data is very clear now. You can blame it on hindsight. You can blame it on, we didn't know as much as we know now at the time. You can do all sorts of things, but you can tell the truth, and then the public will start trusting the CDC again. You can say, it's okay to say, it didn't make any sense to shut down schools. The data shows that now. It didn't make any sense to do major lockdowns. The data shows that now. Doesn't make sense to mask kids. Data shows that now. It's okay to say it. And the public will reward you for it, because it's pretty dangerous thinking about the future when maybe we do have a disease that spreads through America that has a 50% kill rate of 8-year-olds. Then you better mask up. Then you better really start thinking about things. But you know what? They're not going to trust you because you refuse to even say that you were wrong. And you weren't even wrong, so you might as well just say that others were wrong. That's just some advice, unsolicited. I have major questions. I can read a long list of agencies that kind of seem to do the same thing. BARDA, ASPRS, CDC, there's like a defense bio something, NIH. There's a lot of overlap here. I mean, what is the difference between ASPRS and CDC?
Well, thank you, Representative Crenshaw. So CDC does provide the scientific evidence and technical expertise, particularly related to infectious disease and other health threats. ASPR provides emergency response, so I would say, to any kind of threat, a hurricane to an infectious disease threat. So they can bring in resources, whether it's people or stockpile resources, but it's really CDC and that technical expertise that decides, well, where do you deploy it, how, for what purpose? So it's a partnership. You can't have one without the other, and we do work very, very closely together to make sure that we're coordinated.
It seems like a lot of overlap, and there's a ton of academic research that happens at CDC, and I think we have real questions. And the CDC has never been authorized. That's another fun fact. But that academic research also happens at NIH. It's very duplicative. How do we justify that?
So I do think that they are separate types of portfolios. NIH is doing evidence generation. The kind of work that CDC is doing is detection. Are we detecting threats and then responding to them and understanding what best practices work to make sure that we are keeping folks healthy? So that is the work that we are focused on in CDC and in public health. Again, NIH, incredibly important research portfolio. But
no, and I appreciate your intent to create a more operational CDC, but because it's not there right now. We have really no biodetection system. I know you want more of it. I know we talked about wastewater in our previous conversations, and that's all good. I like that a lot, but I do have more questions. I know Mr. Griffith asked about this, but there was a hidden biolab out in California. Reedley, California, local officials discovered the Chinese national was running an illegal biolab with 1,000 transgenic mice modified to be similar to humans, infected with nasty stuff like dengue, COVID, HIV, malaria, tuberculosis. Won't get into a ton of details here. I think the main problem here is why did it take so long to actually respond to that lab and for the CDC to go test it? The American public believes in their minds, like, this is exactly what the CDC is for. Locals can't deal with it. The state is, the Health and Human Services of California is asking CDC to do it. What was the timeline from that ask to actual response?
Well, thank you so much. I was able to share some information earlier that there were a number of inaccuracies in the report that was put together from this. Again, state and local authorities are, as you were saying, are in charge, as well as FBI, FDA. CDC's role was to come in and do an investigation related to select agents. When we were invited and asked to do that, we did respond. We sent a team. They were there for 2.5 days, did an extensive review. What we found was no evidence of select agents. And really what was compelling as I reviewed that information was it wasn't that they didn't have any equipment that would have allowed folks to work with select agents. So not only do we see the freezers and the paper.
But how long did it take from the request for CDC to actually come? Because I thought it took a congressperson from California to get CDC there.
My understanding is that when we were asked, we deployed.
Okay, select agents, very specific. I'm under the understanding that if a vial of something is not labeled, that you don't test it.
So we do have limited authority in some of this space, but what we did was go on premises, again, do a 2.5-day investigation. We did not see any evidence of select agents at this lab.
Using words very carefully, and I'm out of time, but you need to tell us what law that is. So if it says Gatorade on it, and you're like, I mean, it could be Ebola, could be Gatorade. It says Gatorade, don't test it. The law says don't test it. I have a hard time believing the law says that.
Well, so I want you to know.
But I'm out of time, but if the chairwoman will let me keep going, I'm happy to.
Well,
Once you answer.
and I wish I could, but that would not be appropriate behavior by
The
the
woman is
chair.
not gonna go.
But the gentleman wants to, bring up issues of the old false flag in naval combat. Just because it flew an American flag didn't necessarily mean it was an American ship, and I understand that. Now recognize the gentleman from Florida, Mr. Dunn, for 5 minutes of questioning.
Thank you very much, Mr. Chairman. Dr. Cohen, I appreciate you being here today. In addition to being a member of the Energy and Commerce Committee, I serve on the Select Committee on China, and I have experience as a bench scientist at USAMRIID. I'm sure you're familiar with it. It's the Army's Biological Warfare Headquarters, a BSL-4 facility. The Select Committee recently published a bombshell bipartisan report. You're aware of it. You've said on the illegal biolab that was discovered in Reedley, California. This warehouse was located in the center of a small town just across the street from an elementary school and a block down from the city hall. The clandestine, they're calling it a biolab, it's more like a warehouse, was a disaster waiting to happen. The CDC's response, or rather the lack of response, clearly endangered millions of Americans. And there were a couple of things that really stood out to me. The first is that the CDC's Select Agent Program completely failed the people of Reedley, California. The CDC literally refused. They did not respond when they were requested. They responded months later, and only when Congressman Costa made that request to come to the town and assess the situation. The discovery, I remind you, was made by a housing code inspector who was tracing a garden hose that went in a window. That's how this was found. It took a phone call from Costa to get there finally. Once the CDC arrived, months after the first request, the investigation he conducted was completely unprofessional and inadequate. And I say that as a professional in the field. The CDC didn't test one vial, even the ones that were labeled tuberculosis, SARS-CoV-2, and Ebola. An entire refrigerator labeled Ebola. That is a select federal agent, by the way, and HIV was there. This facility is completely unlicensed warehouse, no licensing whatsoever. Over 20 potential pathogens, 1,000 transgenic mice, humanized. There were 0 isolation facilities that would be necessary to either legally or safely handle these agents. And perhaps most egregious and simple-minded, the agency didn't even bother to translate the Chinese labels. There were some vials that had only Chinese labels. Didn't even ask for a translation on this. Amazing. When local officials started to dispose of these materials, they asked CDC what to do with the Ebola. Again, a federal select agent. And a CDC branch chief, I have these emails I'd like to submit for the record.
Without objection?
Thank you. CDC branch chief belatedly responded saying, we don't see an urgent need to test these samples at the moment. Most of the material we identified was not considered a serious threat to public health. HIV, SARS-CoV-2, hepatitis, malaria, and Ebola, not considered a serious threat to public health. But, the conclusion made by the experts at CDC that a refrigerator labeled Ebola was unlikely to contain Ebola. And you look at the totality of this situation, it reads like a nightmare, a horror story. In what world is this okay? And, you know, and I go refer to my colleague Gary Palmer's remarks on trust. How do you expect the American people to take our public health institutions seriously when this is their reaction to a very real situation? CDC should not ignore pleas from local public health. And by the way, the California Public Health Service asked them to sample this stuff too. The CDC should test substances if requested by local government. Surely that meets a threshold test. And I'd like you to explain, I'm going to give you a chance to answer some questions here with the minimal time that's left. Is the CDC supposed to be the first line of defense for human infection agents in the United States?
Well, thank you, Congressman, for the opportunity to respond. There were a number of inaccuracies in that report, and so I want to make sure you know that when we were asked and invited by the leaders of that investigation, FBI, FDA, state and local officials, we did deploy. We did look at, we were there for a 2.5-day investigation, and we did not see any evidence of select agents. Not only did we look at all of the paperwork, the vials, the freezers,
Let me, just
also
because
made
we're running out of time, let me reclaim it. Yes, they responded, but they did not respond when they were first requested. They responded months later.
So
I
that's,
mean, that, and we have that on, I mean, we had that examined by the FBI, came to our committee and told us that. That's who we got that information from. If you have better information than the FBI, you need to let us know.
great. We would be happy to share the more about the timeline, but when we were asked, we did deploy no select agents on site there, and we
I
continue.
mean, how do you know you didn't test for anything?
Well, so right, this is where our experts did a 2.5-day review. I want to address what you were talking about related to Ebola. When we heard after the fact that someone said something was labeled Ebola, we took 300 pictures. We did not see one
It
bit
was
of
on the
evidence
front of a
related to that.
refrigerator.
We didn't see that. We asked folks to say, do you have a picture of that? Could we validate that for someone else? No one could validate that for us. So, you know,
So we
did
just
not.
blow off the California Public Health Department and say, oh, we don't believe you. You know, obviously my time is expired, Mr. Chairman. I have to tell you, though, in my professional career in biological warfare, I have never seen anything like this. By the way, the worst concern I have, this may not be the only one. This is one that a housing code inspector found. Let's marshal all the housing code inspectors
Gentlemen.
in the country. Turn them loose to find these things.
I appreciate the gentleman's passion. The gentleman's time is up, and now recognize Ms. Kamick of Florida for her 5 minutes of questioning.
Thank you, Mr. Chairman. I appreciate you hosting this today. So important. Thank you to you, Dr. Cohen, for appearing before the committee. Without a doubt, public confidence in the CDC has been tremendously damaged by the actions of multiple directives, directors, and choices made within CDC leadership. For example, at one point in time, CDC Director Redfield said that masks could offer more protection than vaccines. And of course, we now have scientific evidence that proves masks do very little to prevent transmission of COVID-19. And certainly we can dive into vaccine efficacy issues and questionable studies that were used to justify draconian lockdowns, but it's clear that the CDC has a very long road ahead to reestablish credibility and regain the trust of the American people. And I'm hopeful that your answers today will determine if you are in fact serious about taking on that challenge. Mr. Chairman, for the record, I'd ask unanimous consent to submit a statistical numerical errors made by the U.S. Centers for Disease Control and Prevention during COVID-19 pandemic.
Gentlelady's requested a document to be recorded into the record.
Yes, sir.
Is there any objection to her document? I believe that's one that was presented to you all a few, 20, 30 minutes ago. Okay, hearing no objection.
I appreciate it. Thank you. Dr. Cohen, your predecessor, Dr. Walensky, overruled the CDC's own external scientific advisory committees regarding vaccine recommendations. Now, at times, she even refused to convene the external advisory group at all. So one of the most glaring examples of this was when the CDC director, Walensky, pushed through for a third vaccine shot, a booster for healthcare workers. This recommendation was rejected by CDC's advisory group, and in response, she overruled the advisory council, moved forward with her own recommendation for a third shot. My question to you, Dr. Cohen, is this: have you convened the external advisory committee since assuming this role?
Yes, ma'am.
Okay, perfect. With that being said, there has been $250 million on top of the $8.75 billion spent in COVID, promotion, marketing, et cetera, from the CDC for this. Sometimes those external advisory councils give recommendations that are contrary to the administration's political agenda. Have you adopted any of the external committee's recommendations, or have you gone against those recommendations?
Well, thank you so much. Under my tenure, I believe you're referring to our external ACIP committee. Yes, they've met a number of times. We actually have new vaccines for the first time in history, so they had to meet for that. They met for the updated COVID vaccine, the RSV vaccine, and all made recommendations for the vaccines that we then adopted.
So certainly there have been some troubling things coming out in recent years, particularly at the height of the pandemic, where members of that external advisory committee were fired for presenting an opinion that was contrary to the political agenda of the White House. In a situation where one of your advisory members presents a divergent opinion, are you taking that into consideration, or are you simply firing these people?
So I'm not familiar with a situation where folks were fired. The way the ACIP works, they have a certain tenure, they serve for that tenure, and they do roll off, and we do choose additional new members. And we appreciate, that these independent advisory committees advise CDC on this work, and I think they're an important component of how we're reviewing vaccines and our recommendations.
Okay, I was actually referencing Dr. Martin Koldorf. He was let go, and this was very recent, again, at the height of the pandemic, and I think that there should be a formal review of how that all transpired, because I think that has a direct impact on the guidance that then becomes issued in public from the CDC. At this time, I'd like you to take a look at the screen for me. There is a screenshot. We have here a sampling of dozens of errors within the data that the CDC was using to justify their positions during the pandemic. These errors excessively exaggerated the COVID risk to children, for example. One of the most damning errors was that the CDC repeated for over a month that COVID was a top 5 cause of death for children. It took months for the CDC to correct this statistical error. Now, during the course of those months, millions of taxpayer dollars were spent to promote the vaccine for children just because a basic data point was incorrect. Now, how do you plan to rectify this? Because quite frankly, if the CDC can't get basic data points correct, the credibility will never be restored within this institution. And also, children who really there was no scientific justification for them receiving the vaccine could potentially, and we have seen documented cases where they have vaccine injuries as a result of that being pushed on them and their parents feeling pressure from the CDC. So can you speak to these errors and how you plan to address these basic errors that have been documented over the past 3 years?
Well, Congressman, I appreciate this, the first time I'm seeing, so let me review and we can follow up. But what I would say is 1,700 kids have died of COVID. But let me tell you what I have done for my own daughters, who are 9 and 11. I got them the original COVID vaccines, and just a few weeks ago they got the updated COVID vaccine. It's because I've looked at the data, and I think that these are vaccines that the safety profile is there in terms of safety, and they are very effective at making sure that our kids are protected. I don't want them to either get into the hospital, nor do I want them to get long COVID. So I got my own kids vaccinated, and so I'm happy to look at this data, but I wanted to at least share how I made a decision as a mom for my own kids.
Well, and I know my time has expired, but I would love to have in writing from you a detail of the threat that COVID presents to children and young adults under the age of 18. I'm sure you probably have that off the top of your head if you can provide us that number.
You can get that to us later. I appreciate it. The gentlelady's time is up. Now recognize Ms. Miller Meeks of Iowa.
Thank you, Mr. Chairman, for the opportunity to waive one to this important hearing. Dr. Cohen, it's nice to see you again, and thank you for testifying today before the subcommittee. As you know, I'm a physician, and I was the director of the Iowa Department of Public Health before coming to Congress. I've not only served in this domain, but I value it and believe that robust public health infrastructure nationwide is crucial to the health and well-being of our country. That's why I released a request for information earlier this year on how to strengthen and reform the CDC to ensure that our nation's leading public health agency is performing as it should. Part of evaluating CDC and agencies in general is realizing when mistakes are made, when programs should be eliminated or altered, and when people need to be held accountable. During the pandemic, in place of clear, reasonable guidance backed by the best scientific evidence available at the time, Americans were faced with confusing inconsistencies at best and clear bias at worst. Whether this bias under a Democrat administration was politically motivated or not, it took public health backwards. Politics aside, there is a near collective recognition that the CDC failed to execute its primary mission of protecting America from health, safety, and security threats by conducting critical science and providing health information that protects our nation against expensive and dangerous health threats and responding when these arise. This includes numerous core operational failures, as you mentioned, as well as total lapses in reliable communication. The CDC's sprawling bureaucracy of siloed and uncoordinated administrative, research, and academic programs with disease, condition, or issue-specific programs was also put on full display. The CDC was originally created in 1946 as a communicable disease center with the mission of preventing the spread of malaria, but has since grown into a massive bureaucracy with a $9 billion budget that supports research and initiatives which are not within the communicable diseases landscape. Additionally, the inability to translate research or real-world published data and evidence rapidly into public health recommendations during the pandemic was detrimental. As a result, trust in public health and faith in our public health agencies and leaders has been decimated. I don't say this lightly or with any satisfaction. Public mistrust of the CDC and healthcare professionals is not good, and it presents a multitude of challenges for the health and well-being of our nation. Unfortunately, however, the CDC has given people many reasons to not trust its recommendations, and given some of the answers you've had just in this hearing, specifically in response to Representative Palmer, it gives me pause that this failure to acknowledge certain things, infection-acquired immunity for COVID-19, its failure to communicate where the agency was getting information it was used to make decisions regarding masking, social distancing, school closure guidance, who to mask, when to get a booster, how to get a booster, even the types of adverse events and adverse outcomes and denial of adverse events and outcomes. I think, to be clear, I vaccinated. I gave vaccines in all 24 of the counties in my district. But when the CDC inserted itself between the patient and the doctor, people rightfully became wary of the agency's recommendations, which we're seeing in this current respiratory illness season now. Dr. Cohen, you didn't lead the CDC during the pandemic, but you did lead North Carolina's Department of Public Health and Human Services, where you were an ardent supporter of restrictive public health measures, such as school closures, which proved to be detrimental not only to the students' academic success, but also to their mental health and social development. Do you acknowledge that the CDC has given Americans good reason to question the agency's recommendations? And can you please highlight how the agency is working to rebuild public trust and why we should review these efforts as genuine?
Well, thank you, Representative Miller-Meeks. I do look forward to this new chapter to turn together, and I want to partner with you as we do that. So there are a lot of lessons learned from the pandemic. Nothing goes perfect in a crisis. I learned a lot of those in North Carolina. I was sharing earlier around transparency, around operational effectiveness, around partnership. So those are all things I bring to the work at CDC. I think we do need to make sure we're learning those lessons. There were mistakes related to our lab test when that first came out, so we had to put processes in place to make sure that would never happen again. We're communicating differently, we're operating differently, but there's still more work to do here, but it is going to take a partnership with Congress and others to make sure that we are all moving in the same direction, that folks can feel confident in vaccines, in the treatments that can save their lives. So I look forward to working with you on that.
Well, thank you very much, but I'm just going to end with, regardless of how transparent you may be or operational excellence and relationships that you may build, if we continue to put recommendations that don't show to the public the risks and the benefits in a transparent manner, we will continue to have a lack of trust in the CDC. Our local public health nurses and doctors did not deny infection-acquired immunity as the CDC and as public health professionals who testified before Congress did, and it was embarrassing. With that, I yield.
Gentlelady yields back. Now recognize the gentleman from Georgia, Mr. Carter, for his 5 minutes of questioning.
Thank you, Mr. Chairman, for allowing me to wave on to this committee and to this important hearing. Dr. Cohen, thank you for being here. It seems that there's been a shift in the CDC toward addressing broader societal issues like climate change and social detriments of health, and I'm very concerned about that. You know, you've heard today the trust in CDC, not only from Congress, but in the general public, and you know this. You haven't been living in a shell. You understand that the trust, the public trust, is lacking right now. We want to help. We're not here to pile on. We're not here to beat you up. We need to help. But I'm concerned now that you're biting off more than you can chew. What's up with this? What's up with these? You know, what's has your mission changed? All of a sudden now you're going to bite off more than you can chew and talk about these issues? Like, I mean, your mission beyond, has it expanded beyond communicable disease detection, investigation, outbreak control into areas such as non-communicable diseases, injury prevention, climate change, social detriments of health?
Well, thank you, Congressman Carter, and thank you for, obviously CDC being located in Georgia. Appreciate your support of CDC and our work. And look, we have a number of health threats that are at our doorstep. Many of them are infectious disease, many of them are not. I look at too many suicides, too many overdoses. The heat.
I would call those mental health issues, so I beg to differ on that. So I'm not, that's not what I'm talking about.
Okay, sorry, then please happy to have you clarify.
Well, I mean, which agency in the federal government do you think is more qualified or more prepared to deal with climate change, the EPD or the EPA, the Environmental Protection Agency, or the CDC?
So, well, specifically related to health and heat. I mean, there are many health impacts of heat that we are understanding more and more. And, what CDC is great at is bringing data and evidence and best practices to some of this, again, whether it's suicide or whether it's how things like heat or wildfires are affecting people's health. We need to have that data and evidence so that our health delivery system and others know how to react to protect.
Well, do you think the CDC's got too many missions, or not enough? Are you looking for more, or what?
well, we do need to make sure we have the resources.
I mean, my hope, and I think the hope of the committee and the hope of Congress and the hope of the public is that you focus on what you need to be doing and that you do it well. I mean, obviously, if we have another pandemic, we don't want to see the same mistakes that we saw during this last one.
Well, Representative Carter, we agree on that. We need to learn the lessons from the pandemic. I agree on focus and prioritization. I think we need to make sure we have risk-based prioritization of what we're doing. There are so many health threats out. We can't possibly tackle them all. We have to be prioritized in doing that. But those are infectious and non-infectious in those health threats. We don't want people in our country dying sooner than seeing early deaths.
Okay, look, I'm not trying to belabor this, but what about deforestation? I mean, that's affecting the environment. How many foresters have you got at CDC?
Ooh, I don't know the answer to that.
You think you have any?
I don't know. I don't think so.
I hope you don't.
I don't know.
Well, I hope you understand my point. My point is that we want you to focus. We want you to get it right, and we want you to make sure that you're fulfilling your mission and not trying to expand beyond your mission. I mean, obviously, we want you to do well. We want you to succeed. But at the same time, you're not going to be able to do that if you broaden into these other things that are getting so much criticism.
Well, I appreciate wanting to work together on that important mission. And again, some of the things we've been talking about to make sure we have the infrastructure needed, workforce response, our lab capacity. I think we're all talking about the same things. I do want to make sure, though, we have the ability to address some of these health issues upstream. I know, particularly your clinical background, we spend a lot of time in different committees talking about the expense of chronic diseases and how much money we spend in Medicare and others on diseases that we know can be prevented. We need to do the research and know the best practices so that we can be preventing these diseases like diabetes before we're paying on it in the back end.
Fair enough. One last question before I let you go, okay? Next to getting to move to the state of Georgia where the CDC is located, what's the greatest thing that ever happened in your life?
Thank you. Well, I'm grateful to be in the state of Georgia. I do miss North Carolina. That will always have my heart, but it's been great to be at the CDC campus, and thank you for your support.
Thank you, and I yield back.
Gentleman yields back, and we're hopeful that Mr. Armstrong is in another committee, and he wanted to ask some questions. He may have to do those questions for the record, but in the meantime, it will have Ms. Castor wants to make a few comments, and then I'll make a closing comment. And we'll
Great,
be,
yes,
we'll
I
be
just
done
have
unless Mr.
a few
Armstrong.
unanimous consent requests. And one was to submit a Politico article about the malaria in Florida. And just for my colleague, Mr. Carter, the reason it's very important for the CDC to be focused on the changing climate, it's hotter. So in Florida, we have longer wet seasons during the summer where it breeds mosquitoes, so that's very important to combat malaria, dengue, Zika. So that's one article for the record. Another is the recent LA Times story that has the unfortunate statistic that more people died in the state of Florida out of the most populous states in the country. And we've talked a lot today about misinformation. A lot of the deaths in Florida came after the vaccine was available. And it's attributed to a lot of the misinformation from our governor and Surgeon General that downplayed the effectiveness of vaccines. So that's another for the record. And then two other, one, a Center for American Progress and the House Appropriations Committee reports, because today I've heard a lot of concern about learning loss in children during COVID, which was a concern for everyone. But it rings hollow, the concern that comes from my Republican colleagues on this, when they have proposed an appropriations bill that decimates investments in public education. If you believe that children need support, that they need good teachers and strong schools, you would never pass these appropriations bills out of the House of Representatives, but yet that's what's on the table. Thank you, and thank you, Dr. Cohen, for your appearance here today.
And for the record, that bill did not pass out of the House of Representatives. All right.
Let's hope it never will.
I don't see Mr. Armstrong. I will say a couple closing things in regard to the vaccine hesitancy. It created a lot of mistrust when current President Biden, during the campaign of 2020, cast aspersions on the vaccines before he became president, became an advocate. Also, I would say that if CDC is going to weigh in on climate, let's make sure we're taking a look at all aspects, and hopefully you can put some guardrails on the EPA, because you're right, heat and cold can be a serious problem, and representing a district that, and take-home pay is 409th out of 435. One of my big concerns is, as we make the cost of electricity, we make the cost of heating your home and cooling your home much higher with some of the policies of the administration, we are actually affecting health for the poorest of Americans who can't afford to heat their homes properly. And as you know, sometimes what they'll do is they'll bring in an inappropriate kerosene heater, or they'll bring in some other heat source that's not suitable for their particular living structure, and we end up with deaths because of a house fire or carbon monoxide poisoning. So these are things we have to take in consideration. I see no one else here to ask questions. I'm sorry that Mr. Armstrong is unavailable. He has another committee where he's stuck in the chair. I get it. But seeing that there are no further members wishing to ask questions, I would like to thank our witness again for being here. Thank you, Dr. Cohen. We have a document list. Many of them have already been mentioned, but I will ask unanimous consent to insert in the record the documents included on the staff hearing document list, which includes Mr. Palmer's, Ms. Kamick's, and your documents along with a couple others, Ms. Castor. Without objection, that will be the order. Pursuant to committee rules, members have 10 business days to submit additional questions for the record, and I ask that the witnesses respond to those questions, within 10 business days upon receipt of the request. And without objection, the committee is adjourned.